then you can reuse that bottle and fetch from the dispensers. The next announcement would be about the Wi-Fi. Again, we realized it was a bit shaky yesterday. That is something we are working on. But the password for the hotel password will be shared with you, and we can use that as we also try to work on better internet connectivity. Final announcement is the poster presentations. They have been stuck on the wall at the back. We request that you interact with those posters during tea break and just see what is there for us to learn. So at this juncture, I want to invite Kellen to invite the first facilitator for the day. Thank you.
Thank you, Dr. Agnes, and to the KVA fraternity. My president, ladies and gentlemen, all protocols observed. My name is Kellen Asena. I work as a country manager for the Global Alliance of Livestock Veterinary Medicines. So I am here on behalf of the GalMed fraternity, and please receive my, on behalf of the team, please receive my greetings. It is indeed a pleasure to join you today to discuss a topic that is at the heart of Kenyan's economy, livestock economy, that is ruminant disease prevention. Why does this matter now, and why does it matter most? Next, Millie. As we all know, the livestock subsector in this country contributes approximately 12% to the national GDP. Of this 12%, the government has an ambitious goal that to be able to grow this for up to 20%. Now, what is interesting that of this 12%, ruminants alone account for 80 to 90%. So approximately translating to 10% of the national entire GDP. This then underscores the central role that cattle, sheep, and goats play, not just to the national microeconomics, but to the livelihoods in this country, and most importantly, to people in semi and arid areas. And of course, by extension, to all of us sitting in this room who are directly and indirectly involved in the animal health resource value chain. And yet, this important resource continues to face significant threats from high-impact transboundary animal diseases that we all know are preventable, and we are not short of solutions. Disease control studies have demonstrated that has one of the highest economic returns as an intervention in the livestock systems, in the livestock economics and livestock systems. And we believe that vaccination can really transform the well-being of our herds. And so this session, as you can see well highlighted, the theme of this session is strengthening ruminant vaccine uptake. This is supposed to contribute to an already ongoing meaningful conversation both by the private, the public, and the developmental sector. Our hope as GalMed is that during this particular morning session, we would be able to ponder and take away the 3 points highlighted before. We should be able to reflect on them, that the 3 points that for reflection during this session and afterward is, how can we scale ruminant vaccination sustainably? Number 2, which PPP models can truly deliver impact at scale? And lastly, how do we transition from reactive campaign-based approaches to resilient system-driven vaccination programs? Because we believe that if we get these 3 critical areas right, not only will we be preventing diseases, we will be unlocking productivity, we will be strengthening food security, and we'll be building a more resilient livestock economy for our country and for the region. And with that, please allow me to invite our first presenter. Our first presenter is Dr. Noel Ainaplan. Noel is a veterinarian with a bachelor's degree from the prestigious Makerere University. He also holds advanced degrees in international animal health and quality management. He currently works with the Global Alliance of Livestock Veterinary Medicine as the senior manager for better regulation. Prior to that, he's done quite a lot of work around regulatory frameworks while working as a senior manager with the National Drug Authority in Uganda. Thank you, Noel. Please welcome.
Good morning, ladies and gentlemen. It's my pleasure to stand in front of this esteemed audience to share with you some of the work that we are doing at government together with our partners. If you could please project the presentation. Thank you. So I will talk about following up on what Kellen has said. Following up with what Kellen has said, I'll share with you the work that we are doing to support veterinary medicine regulation in Africa, because the regulation of products plays a very big role in ensuring that the products that are available for use by professionals such as yourself are of high quality, they are safe and they're efficacious. So arising out of that, just as a background, some of the things that I'm sure you're aware about, the importance of the livestock sector that Kellen has mentioned, and how it supports 350 million households in Africa. And therefore, it is a very crucial sector that a lot of people depend on. Linked to that, we conducted a scoping study last year. We went around Africa and we were able to confirm and establish that there is such a fragmented regulatory framework across Africa, from countries that have got very solid regulatory systems, such as in East Africa, and Kenya is one of them, to countries in other countries where you have 2 or 3 people that are handling the regulation of products. So this, of course, has a very big impact on the products that eventually end up on the market. And of course, we are very aware of the risks of having substandard and falsified products on the market. And also, this is also linked to the misuse of products such as antimicrobials. And as a result, we are grappling with a very big problem of antimicrobial risks, including resistance. So, and as we continue, these are some of the critical issues that we need to also take into account. We all need, the ideal situation would be to have affordable veterinary products. Of course, these ensure, as I've mentioned, that we have a very robust animal welfare and success in the agricultural sector. But because of this, we face this threat of substandard and falsified products. And also it is important to combat antimicrobial resistance. And that, therefore, some of the issues that, as I've mentioned, have contributed to this is having this fragmented regulatory regime across Africa. And the work that we are doing is around harmonizing this regulatory space to ensure that all the regulators in Africa are doing the same things, they're having the same standards, and therefore it ensures that everybody is aspiring for best standards. As we are aware, our borders are very porous. So if you are in this country, Kenya, and you are surrounded by countries that are not regulating their products, they will eventually come into this country. And also the animals, as you know, do not respect borders. Animals always cross borders. So it is important to have a harmonized regulatory system across countries to ensure that even where the products are outside the borders of the country, then those products are effectively regulated. So we have a project called the Better Regulation Project, and we are working with the East African community, the World Organization for Animal Health, which you are all aware about, and we are also working with the United Kingdom Veterinary Medicines Directorate, which is the gold standard for regulation of veterinary products in the world. So these are the things that we're working on until next year. We have established a network for all regulators in Africa called the Pan-African Veterinary Products Regulators Network. We are also working on a tool that we have benchmarked on the World Health Organization Global Benchmarking Tool for Human Medicines, through which regulators will be able to identify critical gaps in their operations. And as some of you may be aware, we also support the East African Community Mutual Recognition procedures, and some of you are already using this procedure to register products across East African community. So this network that we established last year in November here in Kenya brings together all regulators in Africa, and we are now, it will be based at the African Union and will be hosted by AU-IBA, which is based here with the support of the African Union Pan-African Vaccine Center in Ethiopia, and also government will continue providing technical support. Mainly, we are doing this, as I mentioned, to promote harmonized standards so that everybody across Africa is doing the same things to assess, carry out GMP and all the post-regulatory activities, post-market surveillance, and so on in a similar manner. We are also going to build capacities of regulatory authorities, such as the one here, the Kenya VMD, with whom we work very closely. And also the network will better coordinate the regulators across the region so that everybody knows what they are doing, especially in areas such as product recall. If Kenya VMD recalls a product here in Kenya, then an alert will be sent out to all the sister agencies across Africa, and so on, vice versa. So this regulators network is voluntary and it is open to all African Union member states. And we are now in the process of setting up a governance structure, terms of reference, setting up a secretariat that will be based at AU-IBA, and also setting up the steering committee. We are also now in the process of determining a funding strategy for ensuring that we build the capacity of regulators, and also setting up a monitoring and evaluation strategy to ensure that we monitor what we're doing. So, as I mentioned, there are certain action points that I wanted to bring to you as people who are in charge of veterinary services. So once this network is adopted and the countries do a self-assessment of their activities, invest in digital platforms, and that's where the front runner professionals such as yourselves will play a very big role in ensuring that these products that you use, you provide feedback on how they are working and how satisfied you are to the regulator, and then this feedback will help to improve the ecosystem. So as I mentioned, this network will be based at the African Union, and we're working on the technical guidance, and we are also engaging the industry, and as government, we're also providing support towards this network. So the second item that we are working on is a self-assessment tool for all veterinary medicine regulatory agencies, such as the Kenya VMD, as I mentioned. So this benchmarking tool is, we have based it on the global benchmarking tool for the World Health Organization for human medicines, which has played a very big role in improving the regulatory framework for regulators of human medicines, and for agencies in East Africa that have both human and veterinary products regulated by the same agency can testify to the importance of this tool. So this tool will help to provide a transparent evidence-based self-assessment, because right now our regulators do not know where they stand, because there is no tool which helps them to determine how far mature they are and what are the critical gaps that they need to address. Of course, this helps in enabling smart investments because we don't have unlimited resources, so it helps the regulators put money where it's most needed in improving their activities. And then once we do that, we are hoping next year this tool will be adopted by the World Organization for Animal Health, which you are aware is more or less the equivalent of WHO in terms of animal health. And this tool, once it's adopted next year by the General Assembly, it will become one of the various tools of WOA, which will be used to assess and benchmark the regulatory authorities. Then lastly is the East African Community Mutual Recognition Procedure for Veterinary Products Marketing Authorization. This procedure has been in existence since 2017, and it enables East African countries to jointly assess and approve veterinary medicines, and it allows reliance on shared scientific evaluation, while each country issues its own authorization. The sovereign powers of authorization of products remains with the countries, but countries coordinate on how these products are assessed, and then once a regulatory decision is reached, then the countries then issue marketing authorization certificates. So it reduces time, cost, and duplication compared to separate country by country registrations. It improves ability of quality assured veterinary medicines across the region, increases market attractiveness for manufacturers, and supports small-scale producers, and it serves as a model for worldwide regulatory harmonization in sub-Saharan Africa, because once this system was adopted, then other countries have benchmarked it, and they're using it in the various regions. So these are some of the things which go on, training of the regulators. Over 40 products have been, 40 technical guidelines have been developed, and so far 57 products applications have been received, and 29 have been handled, and the rest are in progress. And also we're expanding this. We started with 3 countries, Kenya, Uganda, Tanzania, added on Rwanda, Burundi, and now we are going to add on South Sudan and DRC and Somalia. So this procedure, once the self-assessment tool that I mentioned earlier is adopted, it will help in improving the procedure, and also carrying out regulatory reliance, which is a newer mode of carrying out regulation once it is adopted to also help improve the process. So in conclusion, harmonized regulation of veterinary medicine is important for faster access to safe, effective vaccines through reduced duplication and aligned requirements, stronger control of transboundary animal diseases via timely coordinated approvals, improved One Health outcomes by reducing disease spread and antimicrobial reliance, greater regulatory trust and efficiency through reliance and work sharing, and more resilient animal health systems with better preparedness and response capacity. So in a nutshell, harmonized veterinary vaccine regulation saves time, resources, and lives, and strengthens animal health and food systems. Thank you very much.
So thank you so much, Dr. Aineplan, for your interesting discussion. So we'll move on to the next presenter. Our colleagues, keep your questions and comments. We'll have them later on at the end of the 3 presentations. Our next speaker is Professor Mohamed Fauzi from Suez Canal University in Egypt. He's a professor of virology and is a prolific researcher with over 50 scientific presentations. Dr. Fauzi.
Good morning, everyone. It's my pleasure to be with you today in Kenya. Can you imagine a world free from foot and mouth disease? Please imagine with me a world free from foot and mouth disease. The world lost about $21 billion annually due to FMD. The problem is not the virus itself. The problem is our ways to control this virus. I am not here today with you to make or to talk about minor improvement in FMD control. I am here to discuss with you, to coordinate with you about significant change in FMD control. For decades, we depended upon segregated or separate effort to control FMD. Please, let us coordinate together to control this devastating disease. Leveraging public-private partnership to scale up prominent vaccination lessons from Egypt FMD success. Presented by Mohamed Fauzi Mandour, Professor of Virology and Immunology, Suez Canal University, Egypt. Topics to be covered in my lecture today. First, I will make an introduction about foot and mouth disease, economic impact, geographical distribution, and antigenic variability. Second, to determine the public-private partnership application in Egypt, we must know in details the Egyptian FMD landscape and history. The third one, does the Egyptian FMD PPP, public-private partnership, succeed or not? What is the key pillar of success of Egypt public-private partnership or any worldwide public-private partnership? Then, what is the lesson learned and the result obtained from application of public-private partnership in control of livestock disease? Finally, our call of action and the conclusion. Introduction. What about the challenge? The challenge in FMD is consisted from 3 pillars. The first one is the economic impact of FMD. The second one is the geographical distribution. The third one is the antigenic variant. Foot and mouth disease is the most important livestock disease in the world in terms of economic impact, as 77% of the world livestock estimated to be affected by FMD. And around the $21 billion losses due to FMD worldwide. 2.3 of it present in Africa. What about geographical distribution? Why the FMD is a persistent problem, especially in developing country? According to World Reference Laboratory of Foot and Mouth Disease, the FMD worldwide has 7 pools. 6 of them is present in Africa and Asia. 1 pool is present in the north of South America. So why it is a persistent problem? Due to present in developing country with shared borders and the transportation of animals between each others. One important point is a challenge for FMD is the antigenic variability. FMD contains 7 serotypes. As a virologist, we considered it as a 7 different virus, as the 7 serotype is totally antigenic variable between each other. Contains serotype O, A, C, SAT1, SAT2, SAT3, and the Asia 1. Within these serotypes, there is about 61 tubotype. FMD serotype O alone contain about 11 tubotype. What is the importance of this slide? It is very important to determine the antigenic matching of the vaccine used in your country, to select the vaccine to be used in Kenya. So it is the challenge. What is the opportunity in the future? The opportunity is to use public-private partnership. Please, let us coordinate together, discuss together, shake our hand together to apply public sector and the private sector to control foot and mouth disease. We should take the strengths of both public sector policy and the private sector expertise and the economy to control this disease. Does the public-private partnership apply worldwide? Many countries used it as a case study to control foot and mouth disease, including Egypt. Firstly, in Egypt, we are using public sector mainly in control foot and mouth disease until 2012, with presence of an outbreak of SAT2. This outbreak in 2012 led to loss of about 1/3 of Egyptian animal population. Can you imagine? 1/3 of Egyptian animal population. So our government have a stop. Please, we must coordinate together, public sector and the private sector, to control this disease. We established a policy, science-based program to control the FMD. So we have about variability of million doses of FMD with high quality, lead to decrease of outbreaks. To determine how can we apply the public-private partnership, we should determine the FMD history in Egypt. The FMD history in Egypt is complicated rather than other country, as Egypt is present as a cross-link between Pool 4, as you see, Pool 4 of East Africa, like Kenya and Uganda and so on, and the Pool 3 of Middle East. So it is complicated between East Africa and the Middle East, according to World Reference Laboratory of FMD. History of FMD in Egypt, we have 3 main endemic serotypes, O, A, SAT2, with emergence of SAT1 at the last of 2025. But serotype O started in Egypt at 1951 and is still present until the last outbreak recorded by World Reference Laboratory 2022. So the last outbreak of O in Egypt to 2022, okay? Second one is serotype A, emergent in Egypt at 2006. Before this, we use only public sector to control FMD without any private sector at this year, okay? The last outbreak of serotype A, 2022. Then serotype SAT2, which is emergent in 2012. And the last outbreak in 2018. So the last outbreak of our endemic 3 serotype is 2022. The birth of public-private partnership in Egypt. The public-private partnership in Egypt is a law. Law number 67 of year 2010. But this law of 2010 year, the scope for all projects, including veterinary and engineering and so on. So the start of public-private partnership in veterinary is the start of control FMD at 2012. 2012, as I said to you, it is a huge outbreak of foot and mouth disease from serotype SAT2, lead to loss of 1/3 of animal population. So the government start to coordinate with public sector. Please, we have a crisis. Please coordinate together. We should coordinate to control FMD. So it is started in 2012. In 2017, our GOVS, which is General Organization of Veterinary Services, start to make pairs of Egyptian risk-based strategic plan, which is 5-year plan to control the FMD. Started in 2017. What about the Egyptian risk-based strategic plan? Egyptian risk-based strategic plan started in 2017 by our GOVS, General Organization of Veterinary Services, in coordination with private sector. Experts from both public sector and the private sector meet together to make this policy. What about the major goal of this policy? To eradicate the FMD, decrease the outbreak in Egypt within 15 to 12 years, with decrease the outbreak in the next 5 years. Compared to our baseline 2014 and 2015, which is the baseline of achievement. What about the public-private partnership in Egypt? Key stockholders. Stockholders mainly is a public sector. Public sector is started by our Agricultural Research Center. We have a veterinary serum vaccine research institute, which is a governmental institute to produce FMD vaccine and other vaccines from about more than 100 years. It is present in Egypt and produce FMD vaccines. Our GOVS, which is General Organization of Veterinary Services, that makes the policy and the guidelines to control the FMD. Also, KVA, Central Lab for Evaluation of Veterinary Biologics. Any veterinary biologic in Egypt must pass the KVA. Finally, Animal Health Research Institute, or called AHRI, responsible for epidemiological investigation in all Egypt, collect samples, isolate, make sequencing in coordination with international partners. What about the private sector in Egypt? Private sector in Egypt of FMD, only 3 companies. 3 companies manufacture the FMD and used it in Egypt. It started by Mivac 2012, then Boehringer and Aria. We cannot control FMD without using our international partners. Starting from FAO and Euro FMD, GAFRA, Gulf Med for sure, Berbright, and OpenVac for quality control testing of our FMD vaccine. So, what about the key pillars of success? If we succeed in a public-private partnership in Egypt, what is the key pillars? If you want to use and to apply in Kenya to success the public-private partnership. The first key pillar of success is coordination strategy. The public sector and the private sector not compete each other. Coordinate with each other to control FMD by presence of a strict policy, strict guidelines to control the FMD. There is a unified science-based national program in Egypt now, started from 2017, as I said, to control the FMD. With guarantee to the private sector from the government that we will take your vaccines, we will use your vaccines in vaccination campaign. Finally, vaccine registration. It is very important point. Vaccine registration in Egypt now has a clear guidance, clear policy and guidelines. For vaccine registration, we must meet an international standard. High quality vaccine only applied in Egypt. Second point of success, which is the main point, is the vaccine as a cornerstone. We must use good quality vaccine in the country for FMD, inactivated good quality FMD vaccine. In Egypt, before registration of your vaccine and even every batch of your vaccine used in animals in Egypt must pass KVA, Central Lab for Evaluation of Veterinary Biologic. They make potency test and the efficacy test challenge. To register your vaccine, to marketing your batch of vaccine, this batch, every batch, every batch of vaccine used in Egypt must pass the challenge test. If the batch passes challenge test, can be used to vaccinate the animal in Egypt. If not pass a challenge test, will not used in Egypt. Okay? A challenge test against local isolates of FMD. So it is a good to make antigenic matching with our local isolates. So vaccination now in Egypt divided into local manufacturer and the national or imported manufacturing. Local manufacturer, governmental sector, which is Veterinary Serum and Vaccine Research Institute, and the private sector, which is MIVAC. Imported sector from outside, like Boehringer and the area. This competition lead to decrease the price between public and the private sector, and the tenders lead to decrease the price of vaccine. So Egypt transformed the mass vaccination of FMD in Egypt from twice per year to be 3 per year. In Egypt, we vaccinate the animal every 4 months against FMD, not every 6 months as previous, every 4 months. This is photos from our vaccination campaign by GOVS, General Organization of Veterinary Services, in cattle. This is in buffalo, photos from buffalo's vaccination campaign. Finally, from sheep and goat vaccination campaign. You see, all susceptible animals must be vaccinated to success in public-private partnership and to control the FMD. The last point of success in public-private partnership. Now we have a guidelines, policy by our government, and we have a good quality vaccines. But this good quality vaccine not transported to the animal by good quality. So maintaining of a cold chain behind the bottle, maintaining of a cold chain. There is a strict guidelines in our policy that maintaining of cold chain from the gate of manufacturer to the immune system of the animal, not to the animal, to the immune system of the animal. It is the responsibility of our public sector. Public sector responsible for this cold chain, from receiving the vaccine from the manufacturer until the animal. Okay. Second point, epidemiological investigation. It is the responsibility of both public sector and the private sector to collect serum sample from vaccinated animal in all provinces in Egypt and make epidemiological investigation using serology to determine the immune status of the animal. So, now we should take refreshment only. I wanted to ask one question for you. You are all veterinarian. Did you deal with any FMD cases in field before? Please raise your hand. Wow. So great, yes. A lot of FMD cases present worldwide, especially, as I said, in Africa. So now in my presentation, the topics I covered is short introduction about FMD to select the vaccine matching with your country. Second point, the history of FMD in Egypt was last outbreak from our endemic strain from about 4 years ago of O, A, and Z2. Also, we have a key pillar of success. Starting from coordination strategy, we coordinate together, not compete together. The second one, vaccine. The vaccine, inactivated vaccine, must be high quality, meet international standards. Then, now in my lecture, I will discuss, after application of PBB in Egypt, what about the result obtained? We have a result about application and policy obtained in Egypt. Finally, call of action and the conclusion. The first one of the result and the lesson learned is a partnership benefit, shared resources between public and the private sectors. We should coordinate together even in the resource and the vaccine manufacturing of FMD. Second point is risk sharing and financial sustainability. Third point, technology transfer. One of the most important points of technology transfer is the collaboration between public sector and the private sector in 2017 to establish a risk-based control program for FMD. Utilize the experts from public sector and the private sector to make this policy. Finally, market access and expansion. As I said, this competition lead to decrease the cost of the vaccine, lead to availability of million doses of FMD vaccine in Egypt, not sufficient only for our animals in Egypt, but now Egypt make marketing and export FMD vaccine worldwide to more than 22 countries worldwide now. What about the vaccination coverage? It is the second benefit of our BBB. Vaccination coverage in Egypt, as you said in this slide, you see in this slide, in 2018, 1 year after application of our strategic plan, the vaccination coverage is 66%. At 2024, the vaccination coverage in Egypt reached to 95%. 95% of all cattle and buffalo in Egypt are vaccinated against foot and mouth disease. Number of FMD outbreak, it is according to World Reference Laboratory. And number of suspected cases of FMD decreased from 480 in 2017, reached to 5 in 2023 and 0 in 2024. Number of suspected cases of FMD. Number of confirmed outbreak started in 2017 by 124, then decreased to 0 in 2023 and 2024. So no confirmed outbreaks from our endemic strains O, A, SAD2 serotypes from 2022 until now. So when we compare our results obtained by our baseline, as I said, our baseline is 2014 and 2015. We find that in 2020, there is decrease of the number of outbreak by 92% compared to 2014, and 70% compared to 2015. For about 2021, the number of outbreaks decreased by about 91% and 66% compared to our baseline 2014 and 2015. There is a curve of FMD epidemic curve for our GOVs, General Organization of Veterinary Services, by months, starting from 2017 until 2022. At the end of this curve, there is a sharp decline in the outbreak that reached to 0 in 2022. What about the animal protection and economic benefit? For public-private partnership, until now in Egypt, it is 75% government investment and 25% private sector investment. The result obtained for our public-private partnership in Egypt is protection in these 10 years, starting from 2017, we protect more than 50 million animals, and we save for Egypt $25 billion that utilized before for the control of FMD. So the public-private partnership, you don't pay money more for public-private partnership. If you make it by good way, you will save your money. In Egypt, we save about $2.5 billion economic benefits. So this is the results obtained from application of our public-private partnership in Egypt. What about our call of action and conclusion? The first one, control of FMD is very difficult, impossible to control FMD without using of high quality vaccine met international standards. High quality vaccines antigenically matched with your strains in Kenya, passed a challenge test to meet an international standard to control the FMD in Africa. The second lesson learned is the public-private partnership is the key element, is the key point to control FMD. One hand only not have ability to control FMD. We should collaborate together to control the FMD. Egyptian prove that the public-private partnership model is very important and the most effective for control of FMD through utilizing the public sector policy. The policy must be under the umbrella of public sector, strict guidelines, strict policy for all veterinarians, manufacturing, and farmers. Okay. With utilizing also private sector experience, technical experience, and economy. Finally, in Egypt, we hope to control FMD as our plan within 20 years. Thanks for KVA, Kenya Veterinary Association, and Gulf for your invitation for this presentation. Thank you all.
Thank you so much, Professor Fozi, for this informative presentation. We really appreciate, very educative. Now, remember in the morning we said that ruminants, sheep, goats, and cattle contribute about 10% to the national economy. And with that, allow me to introduce our next presenter, Dr. Enrique Hernandez Pandez. Enrique is a veterinarian, but most importantly, he's a ruminant farmer back in Spain. He's also an expert in development and implementation of commercial strategies. He's currently working with the Global Alliance of Livestock Veterinary Medicines as the Executive Director for Commercial Development and Impact. He has so much experience, about 20 years of experience in leadership, especially in the global animal health industry, with deep expertise in commercial strategy, market development, and expanding access to veterinary health solutions in the African market. And this is demonstrated by his many years working in senior leadership position previously at Merial and Boehringer Ingelheim. His topic today is to increasing ruminant vaccine uptake of coverage by making market systems functional. Karibu.
Good morning. Now it's okay. Good morning. Good morning, everyone. So I'm very, very happy to be here and to try to share some thoughts with all of you as a vet, as a colleague. I'm really happy. I'm really thanks KVA for the invitation and for the partnership. I'm really, really happy to be and pleasant to be here. Thank you, Dr. Prof. as well. It was a very interesting presentation. Thank you very much. So we got your point about joint force, no, game big problems. So we'll have as today. So we'll have a small video that we would like to share with you. Then I will explain a little about who is GALMET. I can imagine that you know, but just a couple of things about GALMET. A couple of things about what we are doing. You saw in some of the poster, Vital 2. I will try to explain what we are trying to do with our partners in Vital 2. This is the intention. But please, first, let's have a look to this video. If you can support us, please, with the video.
Did you know that cattle, sheep, and goats, also known as ruminants, are incredibly important to our world? For many families, especially across Africa, these animals are their main source of food and income. But there is a hidden danger. These animals are vulnerable to highly contagious and deadly diseases. You may have heard of foot and mouth disease, lumpy skin disease, or sheep and goat pox. When an outbreak hits, the results can be devastating. Sick animals grow slower, produce less milk, and have fewer healthy babies. In the worst cases, outbreaks cause high numbers of deaths and cost farmers enormous amounts of money. Entire communities can face strict restrictions on trading their animals. But there is a simple, powerful solution: vaccination. Vaccinating animals is like giving them an invisible shield. And here is the thing: It is far cheaper to vaccinate an animal than to manage a massive disease outbreak. Vaccinated animals stay healthy. They gain weight faster, produce more milk, and have much better fertility. Healthy livestock means reliable income for small-scale producers and a stable supply of meat and milk for everyone. Vaccines can even eliminate diseases entirely. We have already wiped out a terrible disease called rinderpest. And right now, global efforts are working hard to eradicate another disease called peste des petites ruminants, known simply as PPR. Organizations like GalVmed are working alongside key stakeholders in animal health in Kenya, Tanzania, and Nigeria to get more animals vaccinated. Together, we can save animal lives, increase incomes, and build stronger, more resilient communities. Let's protect our livestock. Let's vaccinate.
Thank you. So one question, if you allow me, for the people, for the expert, for our colleague in the room. What is the cost today in a livestock market of a beef cow? Whatever, in Kenyan shilling or in dollar. Who can help us to say the price of a cow today, beef cow? Please, sir. How much?
It is 80,000 to 120,000 Kenya shillings for 450 kg animal.
Wow. Thank you very much, sir. So, someone can tell me what is the price, including application, the vaccine, the more expensive vaccine, doesn't matter where coming from. What is the price today, including practitioner, veterinarian? What is the price? Someone? Dr. Khalid.
Thank you, Dr. Enrica. Tentatively, it depends on the speech of the animals and the type of the vaccine. So roughly, I can say between $1 to $5. Thank you.
Thank you, Dr. Khalid. So even let's say more. Even let's say more. $5. Someone in the room can make a calculation in terms of percentage. We are vet, but we are business as well. We are driven by business. So we have the responsibility to take care of the animal that they already have business. What is the return on investment? 1%? 2%? That makes sense that today see animals losing and creating this big problem. So at the end, the solution is here, is around us. And this is part of the responsibility that we as a vet, we have. So difficult that the situation will change without all of you. So it's a call to really to take this simple but complex message in order to really to keep our motivation and our support on that respect. So let me tell you, please, could you put a presentation? First slide, please. I can manage. So just as I mentioned, a couple of words related to GalVmed with 3 questions: what we are doing, or what, why, and how. So as a GalVmed, we are an animal health product and development organization, facilitator. So we don't have product, we don't have ownership of the product, we don't have service. We are collaborating and trying to support with partners to do some business change that will make the market much more functional. The why is because we strongly believe that taking care of animals, we are improving human life in different ways, in different angles. So, but protecting animal is the central point of our belief and our work. How we are doing in a very simple way. We try to understand where is the problem, where are the constraints. So we saw this morning the presentation of FND. We try to understand what's happened. We try, like with Noel presentation about registration, if it's a problem. Understanding the constraint, we believe that we are in a good position to start engaging, so the different stakeholders as a convening, as a facilitator, and then with the final conclusion to this animal health product, this vaccine will be available for all of you, will be available for the farmer as well. This is how GALMED is at a glance. So I will give you just 30 seconds. Just please have a look and read this that you know much better than me, because you are Kenyan, you are here, probably many Congress presentation, and even yourself in many information you know that. But I will give you, please, read in a couple of minutes, a couple of seconds. On the left, you can see human population. Please, center in Africa. Even continent, geographical areas that came with an important population growth like Asia remain stable. But now your continent, and you saw in the previous slide, will continue to grow. 2 billion people will grow the humanity in the coming years. 1 billion, half, coming from Africa. Go to the right. You see the meat consumption. Look yourself in Africa. How is the consumption of protein? Probably you can realize how important is your job. Probably you can realize how important is your contribution in terms of protecting animals. So in terms of Vital 2, just one slide to try to explain why we are here and what is Vital 2. Vital 2, let us start with the title, the name of the program is 2, Vital 2. So it means that there are Vital 1. So Vital 1 was purely R&D approach. So GALMED with partners, with our partners, remember, we don't have ownership of the products that we develop. Our partners in Vital 1, during 5 years, they develop a pipeline of ruminant vaccination. Pipeline ruminant vaccination that pretend to support, as we saw in your presentation, Prof, that could complement what the government is doing. Join force, not to compete. So during these 5 years, an important ruminant portfolio were developed in the R&D point of view. Vital 2, it was the moment, at that time when the product was developed, we have the discussion about we should continue and be involved, or is market transformational enough to keep it? And then in this case, at that time, we decided to continue. And then we continue with the partnership with the private sector and the public to try to make this vaccine available at the level of the vets and the paravet with the benefit of the farmer. And this is when Vital 2 started 2 years ago. Basically, the intention of Vital 2 is to support the countries, to support the government, to support the farmers with the private sector contribution to really to increase vaccination coverage. Of course, following the mandate of the government, following the mandate of the vet, so doing in the proper way. And proper way, it means starting doing the thing properly. Of course, doing registration. So the scope of the job in this 5-year problem was 3 countries. We selected 3 countries to try to join force in this country that it was mentioned. Kenya, number 1, Nigeria, and Tanzania, with the intention to scale up later on, taking the good learnings. So it's a 5-year program. We are currently in the Q2 of the year 2, and basically the scope of the disease, it was we really focus in the large ruminant, CVPP, lamp skin and Rift Valley fever, and small ruminant, PPR, CCPP, and sheep and goat. Other endemic disease like enterotoxemia, black quarter, anthrax was included as well. So in terms of partnership, so we are partnering with 4 pharmaceutical companies, the private sector, that most of them, they were involved in Vital One, MSD, MCI, Jovac, and Hester. They are the partners, the private sector, that are coming in this journey to trying to support the country and trying to support the vets. So in terms of the areas of intervention, so we partnered with the Kenyan Vet Association. So we feel very proud, and I was the opportunity to be in the field last week in Narok, in Callado. So I really want to thank the contribution of the Kenyan Vet Association in the great job that we started to do, and I believe that will land in a very positive way. So basically, in a very high level, 10,000 meters of altitude, if you allow me. So basically, Vital 2 is related to secure, proper registration. So of this, and our partners are working hardly with your authorities to register properly this product. Some of them are already registered. So work with government, with association, with partners in terms of support you in your work of create disease awareness. How important are this disease that has solution. So other area of intervention is to try to support you in the things, in the way that you are working. So what we call reinforced vet service delivery. And of course, we are committed as an organization to integrate, to analyze what has been achieved, to integrate learnings, and then to try to scale up. So just one slide to give you visibility, to put in something tangible that. So during this time, pre-commercial phase and commercial phase of Vital 2, as end of 2025, this is the picture of how many products has been registered and how many dossier has been submitted in the 3 countries. On the left of the table, you can see a kind of result of the effort, this joint efforts with the authorities, with the private sector, in order to bring product to the market, to have the tools that you need as a veterinarian. On the right, you can see much more specific in what's happening in Kenya in April 2026. So as today, so we have important achievement in terms of number of ruminant vaccine registered, both transboundary disease and endemic disease, and other in the bottom of the bar, you can see that are coming. And what is important and interesting to know, so as a development organization, so we are looking for make market functional. We believe in the power of the market transformation to keep the sustainability. Because we are a development organization, we are supported for grants, but we are not here to stay forever. We are here to live. So, and what we believe is in the moment that we make our small contribution, the market remain sustainable. And it's a good news to know that other companies are starting to submit ruminant vaccine as well, dossier, in order to really to be a contributor, other companies as well in this journey. So again, thank you very much. It's a call to all of you to really to stay together, try to solve one of this big problem that we saw that is possible to be done, but clearly to be done need your contribution. Thank you very much.
So thank you so much, Dr. Enrique, for that enlightening presentation. Just before I call the three presenters for the interactive session, maybe I'll just write on what Enrique has said and just appraise ourselves about the government project. Dr. Enrique has said that KVA and government are in partnership, and that is why you see these with two logos, KVA logo and also government logo. And so we have a project whose key aim is to strengthen ruminant vaccine uptake, and that is in Kenya. It is the project is meant to run for about 4 years, and it is in about 9 counties. But for now, we are focusing on Kajiado and Narok, which is why Enrique mentioned that he was there last week. The whole point of the project is to raise the uptake of the vaccines within the country and also the counties. Right now, it is estimated to be about 5% coverage, and at the end of the project, we are hoping to raise it to 70%. Project is focusing on 5 key diseases, that is lumpy skin disease, contagious bovine pleuropneumonia, contagious caprine pleuropneumonia, sheep and goat pox, and also PPR. So those are the 5 priority diseases. So KVA and government are collaborating to increase disease awareness in communities. And so that is, for example, why we are here being appraised about these diseases and vaccines and all that. Again, we are also going to be sensitizing farmers. For example, today one of our colleagues, Dr. Ezra Saitoti, will be on radio speaking in the local Ma language and also Swahili, again, to sensitize the farmers in those 2 counties of Kajiado and Narok. The other key objective of the project is to strengthen vaccine service delivery. So here the project will be supporting cold chain. So here we'll be giving solar-powered fridges and cooler boxes so that at the very last mile agrovet, these vaccines are available, and of course they remain viable. Without further ado, I would like to ask the 3 presenters, that is Dr. Eineplan, Professor Fauzi, and also Dr. Enrique, to just come to the front here so that then we can now have our interactive session where you can now ask your questions and comments. So Millicent and Vivian, will ask you to pass the mic around. So if you have a question, just raise your hand and the mic will be brought to you. Have a seat, thank you. Yeah. There's a question by Dr. Shepello. And as you ask the question, we request that you say your name and also say who you're directing the question to. Thank you.
Thank you. My name is Dr. Menda Nyamoma from Mount Kenya Milk. My question goes to our colleague from Egypt. A very interesting presentation. During the presentation, I was trying to run through and really feel quite interesting that you are at 0 reported cases, suspected cases since 2022, and that's impressive. And we would love this country also to be at 0. So I first ran a little into your data. It might not be the true data, but a sketch of the same. I saw you have a population of about 8.1 million animals that you do vaccinate. And from your presentation, you actually did do 4 vaccinations in a year. And then I ran down to look at the population of the veterinarians who are actually executing the same. and I saw something like 16,500. So how are you able to do those numbers 4 times a year with an estimated of 16,500 professions? I'll really, really love to internalize that. Thank you.
Okay, thank you very much. My name is Dr. Hesbon Nawando from VetCare Kenya Limited. My question is still to the Egyptian and probably slightly to the specialist of government. I noticed
Dr. Awando, you are requested to raise your voice. They can't hear the
Okay.
question.
Are you hearing me now?
It's better.
Okay.
Yeah.
I'm saying probably it can be supplemented by a response from the specialist from government. And from your data, you indicated that lessons you learned from the Egyptian strategy was generally in terms of partnership in the PPP. The government had a contribution of 90%. Is it true? 75%. And private sector, 25%. Now, my major question on that is our historical observation is that a government that behaves in a limping duck approach to public interest national services rarely realizes the benefits, especially where the private sector does not really have room to come in. Do you think that your success that you are sharing with us is basically out of the government effort? And do you think without government effort that you observe, you could have achieved those figures you have? Because I believe the social setup in Egypt could be a little bit different from what we have in Kenya here. And certain expectation as seen here in Kenya could be so different from what you have in Egypt. And probably a lot of land tenure system and all that. Probably from the government, in the approach which you are now undertaking to try to expound on the PPP uptake within the Kenyan disease control vaccine uptake, do you see any mirage that you have a success, especially that now you are at 5% for what you have done, and we are projecting to reach 80% or so? Thank you very much.
Thank you. I'd like to ask the N+, the person who presented about regulatory authorities for the vaccines, and I would like to ask about the efforts being made to strengthen the testing laboratory infrastructure among the countries that you mentioned. Thank you.
So, Dr. Terry and colleagues, as you're asking your questions, in the interest of time, we request that you go directly to the question and maybe keep it to a maximum of 2 questions.
Okay, thank you. Thank you, Prof. My question is to Prof. Mohammed. My name is Teresia Wangare. In a devolved system like Kenya, where the vet services are mostly county-led, which aspects of the Egypt's PPP's model for the FMD control are most adaptable? In other words, how can we ensure that there is effective coordination and consistency across counties? And also, what is the cost of the vaccine per dose in Egypt right now?
So, Dr. Shepelo, you can ask your question, and then we can let the presenters answer that round of questions.
Okay, thank you. Gertrude Shepelo is my name, from the University of Nairobi. My question goes to Professor Mohammed. So, great progress, of course, on your vaccination. My question is, what role has animal identification played towards your success, and what methods of animal identification have you used and are you currently using in your country? Animal identification and traceability for you to have those accurate numbers. Thank you.
So I think we can now let the presenters answer those questions, and then maybe we'll take a final set of questions. So maybe you can start with Dr. Fauzi. Okay. There's a microphone.
So concerning the first question of Dr. Menda, you said that in Egypt we have around 81 million of animals, as I said. So you are right. In Egypt we have around 8 million head of cattle and buffalo, for sure. But we didn't vaccinate 4 vaccination per year. We make 3 vaccination campaign in Egypt per year. Before 2017, we have only 2 vaccination campaign per year, every 6 months. But as according to my knowledge in vaccine manufacturing, the FMED vaccines give maximum protection for 4 months, as it is in inactivated vaccines. So we mainly transform the vaccination campaign in Egypt from 2 per year to be 3 per year. So we vaccinate every 4 months. So we have 8 million animals. We vaccinate every 3 times per year, so we need around 24 million doses of FMED vaccines. In Egypt, before 2012, you only have 1 public sector manufacturer of the vaccines. But imagine now, by public and private sector coordination, we have 4 manufacturers of vaccine. 4. Our Veterinary Serum and Vaccine Research Institute, our governmental institute for FMED vaccines. My master's degree was there with them in FMED vaccination. Okay. Other 3 private sector, which is MIVAC, Boehringer, and ARIA. So we have good quantity, million doses of FMED vaccines now after 2017. This million doses is sufficient not only for Egypt, but also we export our vaccine to other countries worldwide, in Middle East and Africa. Okay? For veterinarian in Egypt, you said that we have around 60,000, really, 60,000 veterinarian. Most of them, of the veterinarian, are registered in GOVS, General Organization of Veterinary Services. In every province in Egypt, we have a campaign also for veterinarian. Veterinarians are working in vaccination campaigns in Egypt, as you see in my presentation, in the picture of my presentation. Okay? This is the first question. My answer is the first question.
All right, thank you. Do you have another question?
Oh, yes.
You
For another question, for Doctor, you said that for public and the private sector investment, it is 70% public sector and the 25% private sector. Why until now the public sector is 75%, as according to our policy and guidelines for risk-based strategic plan, most of responsibility is present on public sector to control the vaccination campaign, not the private sector. Public sector is responsible for manufacturing of vaccine in our governmental institute, which is Veterinary Serum and Vaccine Research Institute, is the first one. Also responsible for vaccination campaign. They take the vaccines from the private sector. Vaccination campaign is not responsibility of private sector, it's public sector. Also, public sector responsible for cold chain, transportation of vaccine from the manufacturer until the animals. So it is about around 75% investment. Private sector rule have mainly 2 rules. The first one is manufacturing of good quality vaccines according to our guidelines. Every batch of FMED vaccine in Egypt must pass a challenge test in our KVA, Central Lab for Evaluation of Veterinary Biologics. Okay, so we assure and guarantee good quality FMED vaccine utilized in Egypt. Private sector only manufacturing good quality vaccines. The second rule of the private sector is only help the public sector in epidemiological investigation, making VNT and SNT. So until now, it is 75% public sector and 25% private sector. Okay, it is the second question. The third one. For the third one, I think the doctors asked about the infrastructure, about the countries utilizing Vital 2 or for epidemiological or for what? Please again this question. The third one. Third question, about the infrastructure, doctor. Please again, sorry. Yes.
Dr. Kiema.
Sorry, I was asking about the strengthening of laboratory infrastructure in your country for the testing and the quality control of those vaccines. Thank you.
Thank you. I think that question was addressed to me. Yes. What we are doing to strengthen laboratory structures in the country, in African countries. Maybe just as a background, quality is inputted in the product from the time it is manufactured, how it is packaged, how it is distributed, who handles it, and so on. And laboratory testing is just one of the things that assures quality. So as I mentioned in my presentation, what we have done is to ensure that we have harmonized technical guidelines which the regulators use to assess the quality, safety, and efficacy of the products before they come on the market, and when they do, to ensure that the post-market regulatory activities are also standardized. But we are also working, as far as vaccines are concerned, with the African Union PANVAC, which is the Pan-African body responsible for ensuring quality of vaccines. And one of the requirements that have now been instituted is that every batch of vaccines that is used on the African continent has to first be tested by AU PANVAC or other World Organization for Animal Health reference labs to ensure the quality. And I also mentioned that we are already building capacities of regulatory authorities to ensure that they have laboratories, both in terms of the human resource and also the equipment that they use. We also encourage countries to leverage the use of labs in countries that already have developed labs, and this is already ongoing. For example, the countries for example, countries such as Burundi use the laboratories in Uganda to test their vaccines and so on. So we encourage this twinning program so that countries can improve their capacities. So those are some of the things that we're doing. Thank you.
Thank you so much, Dr. Ineplan. Maybe as we take the next round of questions, maybe Dr. Enrique, you can tell us about your Vital 2 project. Are you also running it in other countries? Which other countries those could be? And what is the success rate if indeed you've already completed any projects in any of these countries?
Yeah, thank you. So yes, we are working as a tier 1 countries, Kenya, Tanzania, and Nigeria, and we are learning in all countries. No, I think that the transversal learning is something that is giving a lot of value. It was one question related to PPR, also to the how Egyptian private and public bodies are doing. If something is applicable to this project, no, I strongly believe that yes. So of course we need to be well aware about the identity of the countries, and it's not copy paste. Nothing is about copy paste. What's happening in one country that will work in another, no. So, but it's a very inspirational to see the number one, in my opinion, that is not impossible mission. For me, this is one of the key learnings, no, that give us the motivation to keep going and play our role as a vet, for instance, in Kenya. So getting diving in the frustration that our country is in 5 or 10 or 7% vaccination rate, there are no any value. So I think as a professional, to see that other countries did, so give us the motivation that is possible to be done. So probably we will not eradicate FND, but my suggestion here is to think, what is the value if we move the country, whatever will be the specific disease, from 5% to 6%? Just 1% of vaccination bring value. Imagine that if we are going instead of 7 to 10 and to 12, it's a long journey. It's a long journey in terms of learnings, in terms of doing effort and resources. And for us, we see this transversal value, at the same time the possibility and the feasibility to be done. So, and this is why we are pay attention in transversal and really very open what's happening in other countries. And then take it the identity of Kenya. So it's not GovMed, it's not Hester, it's not Jovac, it's not KVA, it's a joint effort in this journey to really to try to increase vaccination coverage. Working together, I think is a good message that I take it as a takeaway.
Thank you so much, Enrique. Yeah, indeed, collaboration is a way to go. So you can take another round of questions. Maybe we can, I think there are very many hands. I think we can start with the back. And again, as I said, please state your name and also say who you are directing the question to. Dr. Kimeli, I don't know who has the microphone. Oh, good Lord. Yes, you can start since you are ready.
And, good morning to all. Thank you very much for the presentations. My name is Khalid Saeed. I'm from Jovac. And my question is addressed to Professor Muhammad Fauzi. You mentioned during your presentation that you are vaccinating 3 rounds per year. And the livestock population is around 8 million in Egypt. Can you just give us tentatively what is the cost of 1 dose of vaccines and how much it costs in each campaign in total? Thank you.
Dr. Kimeli has a mic. Go ahead.
Thank you very much for the opportunity. My name is Peter Kimeli, and my question is directed to Enrique Pando. First, I want to appreciate the decision to partner with Kenya Veterinary Association in delivery of your programs. And I want to believe that that's the right partner because it has all the literally players in the animal health space under the same umbrella. 2 questions for you. You said you had Vital 1, you now have 2, and maybe you might end up with 3 or 4. What would you consider to be a success in the delivery of Vital 2? And the second question is, COVID-19 taught us many things. And there is a possibility that in future also we might not even have aeroplanes again flying, and everything would have to happen in country if possible. What's your position as government in improving the in-country manufacture of some of these products, or even partnering with the local producers? Thank you.
I'm on the floor.
Yes.
Asante, huko nyuma. Nilikuwa napendekeza mkutano igawane mara 2, lakini sina sababu nyingine. My name is Dr. Soka Ituru, a veteran veterinarian. My question is to Professor Muhammad Fauzi. First of all, thank you all the presenters. This has been fantastic. Professor Fauzi, in the country I'm coming from, political and religious extremists and hardliners are a big impediment to vaccination coverage. You find ourselves fighting misinformation, and other propaganda when sensitizing the populace on the importance of vaccination. I wonder, do you have this in the Arab Republic of Egypt? And if so, how have you overcome this? And what advice would you give to us in our country? Thank you.
Go ahead if you have the mic.
Thank you very much. My name is Wairimo Gishingiri. I work for the Kenya Veterinary Board. My question is directed to Dr. Enrique. Thank you for first bringing the project Vital 2 to Kenya and starting it at Narok and Kajiado. The implementers of the vaccination campaign will be coming across a lot of data in terms of the number of animals vaccinated per day, per week, per month, and for the entire year or for the entire 5-year period. My question to you is that this data that will be collected, since we see that human beings forget and would like to track the data, is there a tool, an ICT tool that you are using to record this data, having that Kenya is enjoying 4G connection and in parts like Nairobi and Mombasa we are enjoying 5G connectivity? Is there any ICT tool that you are using to ensure that this data is captured? Thank you.
The mic was on that side. You can go ahead and ask the question, Dr.
Can I
Fine.
proceed?
All right, Dr.
Thank you.
Nyamoya.
The eradication of, my name is Dr. Martin Nyamoya, a retired vet. The eradication of rinderpest was both at vaccination level and post-vaccination analysis to look at the response, antibody response to the vaccine. In this particular eradication of FMD, are you trying to do post-vaccination analysis to see what is the response of the animals? Thank you.
Who is the question directed to? Sorry.
Any of they're all in the FMD space.
Okay.
Good morning. My name is Muse, Dr. Muse. My question is directed to the asker of the question herself, Agnes. And my concern is about the project. It does not encompass all the diseases of concern in the animal health space, ruminants, that is. How I wish we could borrow a leaf from our small animal practitioners, because immediately a pup drops, they know what to do at day 1 all the way until the time is going to be cremated. I wish you could develop a comprehensive vaccination program for livestock, because you may succeed in the diseases that you're targeting currently, but you'll still not be able to access the lucrative markets, and you still be experiencing high mortalities, because the diseases you've left out will have a more, a larger population to clear. Thank you.
So I think we can have those questions answered after you have asked your question, Dr.
My name is David Mwangangi, Daktari. The question goes to Professor Mohamed Faus. I don't know whether I've said it correctly. So my question is, in our environment, East African environment, we do have what we call transboundary animal movement. Animals are crossing all over from Somalia to Kenya, from Tanzania to Kenya, and vice versa. So the question is, how do you recommend we are able to eradicate the FMD given our local environment, and even if we implement this PPP as a country?
Before Dr. let them answer, and then Dr. Kimta, you can ask next. So maybe Dr. Aineplan, you can start by with responding, and then we can go this way. You had no questions? All right. But there was a question that was asked to everyone generally by Dr. Nyamoya. You can maybe just comment about that.
Just to respond to Dr. who asked about, before Professor Faus comes in, on the issue of as I mentioned in my presentation, the issue of transboundary diseases and the movement of these animals across across our East African countries, just like the people, the way we move is that one of the things that we have done is to support the way these products are regulated, so that even when the cattle and the other ruminants are roaming around East Africa, wherever they go, they will encounter a robust regulatory system, so that even when they cross over to Uganda or to Kenya or to Tanzania or the other East African countries, the FMD vaccines that will be in those countries will have gone through the same robust system, and this will contribute to the eradication of the disease. Right now, the FMD vaccines that are available in these countries and have been registered have been jointly registered. So the countries have all registered these FMD vaccines together, and that's one of the ways that the regulatory regime can help in the eradication of the disease. That's just one component. Thank you.
Thank you so much. Maybe Dr. Enrique, you can go ahead.
Yeah, we have 5 minutes, I saw. Thank you. So I will try to go quickly with the, I saw 4 questions that probably can support something. One, it was related to the success of the project. Yes, we have key indicators in order to measure the success. We have, if I remember well, 16 KPAs. So how many doses will be sold, how many products will be registered, all this type of thing. But for me, in my personal expectation, with the responsibility that I have, at the end is how to make market more functional. So because of making market functional is an indicator of the sustainability and not grant dependent. So with my team, we are really focused to see how Vital 2 will make some transformational market change that will allow you to continue. In fact, you are doing the transformation. No? For us, is what we are selling. For instance, what my colleague mentioned, if at the end of the project there will be many or significant number of product vaccine registered for different companies that is giving the tools that you need, for us is a success. So in terms of potential other business modalities, I think that you are in the direction of industrial partnership, not only producing finished product. So I think that we should be open. So because all modalities could be a contributor, no? So the traditional model of producing outside Africa and then to export is good. It's a way to guarantee product availability, complementing what the national lab is doing. But there are other modalities, but this is a matter of discussion in between your government with the private sector. Again, our role will be to try to facilitate if it's possible. So question related to data sharing, totally, absolutely. We strongly believe intelligence, data sharing is something that can bring value, because it's a joint force. We are happy with Kenyan Veterinary Association is one of the fundamental points in our agreement to collect the data, and how to use the data, in my opinion, totally open with that. Last point was about, and this is important point that I want to clarify. So normally in business, people used to, and companies used to work based on focus. What is the focus? But doesn't mean focus that we are neglecting other things. I refer to 2 things. One is related to country. When we mention counties, Narok and Callado, doesn't mean that we are not interested in the other. So, but probably some indicator, some activity that is focused in Narok and Callado is in parallel with other activity that is doing in other counties, but probably is where we are not so focused in terms of traceability and getting information. So focus doesn't mean neglect. The other example is coming from our colleague of CKL Africa. I think that we are focus in transboundary disease. But our main intention, and please remember, our main intention is to vaccinate animal. Any simple animal that die, doesn't matter, that will be for Clostridium, for botulins, for lambskin, for CVPP, matters. So it doesn't make any sense today that one animal died for anthrax, for instance.
Regarding the other questions I directed for me, the first one is a cost of one dose of vaccines. It is very important questions. In Egypt, we have 2 schedules of vaccination of animals. The vaccine is already available in our GOVs, General Organization of Veterinary Services, with a vaccination campaign, as we said, 3 times per year, especially for all animals and all farmers present in Egypt. The vaccine is afforded by our GOVs, contain FMD vaccine, 2 vaccines, FMD and Rift Valley fever. Okay? So it is a strict vaccination for both Rift Valley fever and the FMD. The price of one dose is around 40 Egyptian pound, which is around 0.7 US dollar, less than $1 for farmers and for. But some big farms can use other international or locally produced vaccine upon their own response, but with other cost for sure. But the international or the public cost of FMD vaccines available in Egypt is less than $1, which is funded by our government, funded by our GOVs, General Organization of Veterinary Services. Okay? The second question for post-vaccination monitoring, for sure, in Egypt we make post-vaccination monitoring under the organization and the policy of our government, especially by AHRI, which is Animal Health Research Institute. Animal Health Research Institute, in coordination with GOVs, veterinarians, that veterinarian working on GOVs, responsible for collection of serum samples, representative serum samples from farmers, even small farmers, collect samples, serum samples from them to be tested using VNT and ELISA, okay, against FMD, to determine the immune response present in animals to make revaccination again, okay? Okay. So I think it is a question. If you have any question, we are with you all the conference, okay?
Yeah. Thank you so much, our presenters. We've run out of time, but maybe just respond quickly to Dr. Muse and also to ride on what Dr. Enrique has said. The project is focusing on 5 diseases. Of course, there are very many livestock ruminant diseases, but then the project is focusing on the key transboundary animal diseases. FMD, I know you will see, is glaringly missing out, and the government is handling that. Dr. Mukora is here, and there's a project by PETS, which is handling FMD. And so therefore, this project is focusing on the 5 diseases, as we mentioned. Again, we said we are also sensitizing farmers, and this is for sustainability, so that such that the farmers are actually the ones who are demanding the vaccines. Again, we have KVA, which produces these vaccines, and in support of that, we have 4 commercial partners who are bringing in vaccines to supplement what is produced locally. Thank you. And so therefore, in the interest of time, I think we'll call this session to an end, although I see Dr. Maritim is really raising his hand. We'll allow him one quick question, and you must really go to the point, after which we'll proceed for a half an hour tea break.
Okay. Good morning, everyone, and thank you, Anne, for the opportunity. I think mine is to Professor Ahmed for a good presentation on control of FMD. What I just want to pose is that you didn't tell us who is really the convening force behind these private sector-driven vaccinations, because you've heard from our talk here there is county, there is national, there is vets here. What you've done, we have done it before in Kenya. And it seems it had worked when the KVA used to do regional vaccinations with the government, and it almost worked, but the ball was dropped down. There is only the government, which is both county and national. Then there is the farmer. I wish the farmer would be the one to convene, because the interest is centrally on the farmer, the owner of the animals. These other players need to come to play, give their contribution. And I don't know how best the Egyptian government policy driven that public sector driven participation. It can work, but it looks like the county government, there is no animal which is devolved. If animals remain the same, it is the players who have their own interest, which have actually
So I think we can proceed.
Thank you.
Yeah.
Well, eh?
Yes, thank you. So you can proceed for tea. It's at the same place, half an hour, and then we come back. Tea is at the same place as we had it yesterday, half an hour, and then we come back.
Tetema. 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 Oh mama. Oh mama. Oh mama. Oh mama. Oh mama tetema. 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 Oh mama 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 tetema. Kicha kime, kime, kimempa. Kime, kimempa. Kime, kimempa. Kime, kimempa. Kicha kime, kime, kimempa. Kime,
right, colleagues, let's settle down, please, so that we can embark on our next session. Settle down, please. We need to start this next session. Our ushers, please help our delegates to settle down. Thank you. Ushers, help our delegates to settle down, please. Delegates at the back of the conference room, please settle down. Dr. Kelvin Mbai, settle down. Dr. Kibet, come on, please, settle down. Oh my. All right. Let's settle down, please. Delegates at the back of the conference, settle down so that we start. Sikuoni ndugu yangu. Thank you for settling down. Now we are going to get to our mid-morning session. And as you can see from your program, the mid-morning session is supposed to run for an hour. We've already eaten some few minutes of that hour. And I would like to start by asking them, settle down, please. Let me start by recognizing the presence of the county government representative here, the CDVS and the CEC. And I would like to quickly start by asking the members of the National Executive Committee to just stand so that we can see them. Wherever you are a member, if you are a member of the National Executive Committee, please stand. Yes. So, Ruto, kuja mbio tafadhali. So, the delegates, I just want to introduce to you the members of the National Executive Committee standing here. From Dr. Joel Ruto, please, that's Joel Ruto, he's a committee member. And then Dr. Agnes Maina here. And then the person in charge of Science Committee, Dr. Daniel Moasia, there. And then we have himself, the CEO, Dr. Muchelule, there. And then, of course, myself, your honorary secretary. And finally, the president, Dr. Osore. And then Professor Kimwele is walking majestically to the front. You can see him there. He is also a member of the National Executive Committee. The other members are busy out there, making sure everything is in order. So we will have an opening session for this conference. And to start, to welcome you members and make you feel at home, that we appreciate that you are able to attend this year's Congress. It would not have been successful without your presence. So count yourself as part of the success of this conference. Apart from the sharing of knowledge that we really encourage here, we also encourage lots of networking. We understand that it is very possible that some of you met in our last conference. And this is an opportunity, therefore, to bring all our members together. In this Congress, we have a total of, well, still counting, 340 participants. We are glad that you all made it for this Congress. So I wouldn't want to take lots of your time with my remarks because I will still have a meeting with you on Thursday. That will be our annual general meeting. But for this, let's share the science. Let's take our place as veterinarians in this country. Let's play our part. I've always told those whom I have met that it is possible to raise the contribution of the livestock sector to the GDP. As long as we remain a small contributor to the GDP, we may not be able to make our voice heard out there or make our demands to the government. But if we are able to increase the contribution of the livestock subsector to the national GDP, then we will be very able to, make our voice heard. We can speak about veterinary services and veterinary health in a bigger way. Okay? Now, allow me, therefore, to recognize all the CEOs that are present in this meeting today. If you are a CEO for state parastatal, please rise so that we recognize your presence. So we have Dr. Alex Sabuni. Even you, Muchelule, you're a CEO. Oh, okay. Muchelule, I'm advised that you sit down. So we have Dr. Alex Sabuni and Dr. Mwema down there. That's Mwema, isn't it? My eyes are, yeah, good. So let's give them a clap. That's not what was in my mind. I wanted a single clap that is mighty. Okay? So can we have them one clap? That's nice. How do you like that, Dr. Sabuni? It's good? Good. Yeah, he likes it. All right. The next, the next group that I would like to recognize is the chairpersons of all parastatals. Chairpersons present. Chairman. Kuna? Oh, chairperson. So, yeah. Yes, we have the KVB chairperson there, Dr. Mushibi. Thank you very much. We have Dr. Mutai. Thank you very much. We will do a clap for all of them, but we just need to know who is here so that you know how to network when the networking time comes. And then we have Dr. Ningala there. Asante. Kuna mwingine namwona. Dr. Kariuki, Chair of Coast Branch of Kenya Veterinary Association. And who else? Dr. Remy, Chairperson of Eastern Branch. And then Dr. Mukami. Dr. Mukami, raise your hand. People don't know. Yeah. Chairperson of the Wildlife Branch of the Kenya Veterinary Association. And Gina Ndonga. Sindio? Dr. Ndonga, Chairperson of the Valley Branch. All right, so let's, those were many. Let's give them 2 good claps. So, mbili, Very nice. We are together. Now, I had already said that the county leadership is here. And so we have the CDVS and the CEC. The CDVS, Dr. Mwalonya is there. And the CEC, they will get their time later on. Okay, let's clap for them. Again, one. Are we together? We should be together. So one clap. Sawa. All right. Second last is the directors. Do you have directors? Very important persons. Yes, you are directors. Yes, yes, yes. Okay. All right, so now, I do not know many of them. Can I request somebody to help me? Sakwa? Sakwa? Kelvin? Okay, let me request my president to help me recognize them. I know some, I don't know all of them. The small mic, please. Okay, Kuja.
All right, so thank you, Honorary Secretary. I don't know everybody myself, but starting from there is Dr. Sakwa Kamama. Just raise your hand. He's a board director, Kenya Veterinary Board. Standing next to me is Dr. Agnes Maina, board director, Kenya Veterinary Board. Then we have Dr. Sabenzia Wekesa, board director, Kenya Veterinary Board, representing the DVS. Standing next to me is board director and chairman of the Kenya Veterinary Board, Dr. John Mushibi. Daktari, remind me. Yes? Sorry, I actually forgot that we have CDVSs. Which county, Doc? CDVS, Baringo, Dr. Kiptum. Then Dr. Isaac Lekolol, board director, Kenya Veterinary Board, representing the Wildlife Service. Next is Dr. Romona Ndanyi, board director, KVA. And then Dr. Diana Onyango, please raise your hand. Vice Chairman and Board Director, Kenya Veterinary Board. Daktari, please remind me. Yes, Dr. Mtungi, CDVS, Meru County. And then, please remind me, Daktari. Yes? Yes. Nairobi City County. Oh, yes, Director. Sorry. I'm growing older, a bit quicker. Thank you so much for being here. And then you have Dr. Eric Sorry. Dr. Josephat Mbai, the CDVS, Makueni County. And then from there, we have 3 board directors, Kenya Veterinary Board. Calvin Ninga, board director, Kenya Veterinary Board, just raise your hand. Then Oreste Kuria, board director, Kenya Veterinary Board, please raise your hand. And then Walter Kemboi, board director, Kenya Veterinary Board, and chairman of the Association of Animal Health Technologists and Technicians of Kenya. Thank you, sir. And then please remind me. Sorry. Dr. Kamonzo? Oh, yes, Kitui, CDVS, Kitui County, Dr. Kamonzo. And then, yeah, just excuse me. This is Dr. Melita, CDVS, Kajiado County. I can't see clearly. I'm aging quicker. Dr. Akwimbi, Director, Kentech. Have I left out anybody? CDVS, Dr. Kuria. Dr. Ngugi, sorry, Laikipia, Taita Taveta County. Again, old age. We'll just let them introduce themselves so that I don't make mistakes.
Yes, my name is Daniel Chepkwan, the CDVS Nandi County.
So much, Daktari.
Dr. Joseph Arab Kieng, CDVS LKO Marakwet County.
Thank you so much, Daktari. And then we have Dr. Mary Teresa Agutu, you know her as the CEO KVB, but is a director at the Veterinary Medicines Council, right? Thank you. She will, you will see her a lot here, and you'll hear from her later on. I hope I've not left out anybody else.
Yeah, Chair, there were 2 more there. There were 2 people there. The last 10.
Yeah, sorry about that.
Dr. Samuel Chelimo, the County Director of Veterinary Service, West Pokot.
And welcome. Any other? Asante. Thank you, Honorary Secretary.
All right, thank you. We need to appreciate all those directors that have been recognized in this Congress. I don't know how best to do that, but since there were many, let's do a 5 factorial, isn't it? Okay. So we start. Thank you. Thank you very much. Now, I'm a lecturer, and I would have given you exceeding expectation for that particular club because we really did well. Now, as I exit the stage, I would like to welcome the KVB chairperson, Dr. Mushibi, to give his remarks. And then after that, we'll invite the KVA president to take over the rest of the program from there. Karibu, Dr. Mushibi.
God is good all the time. Mungu ni mwema na kila wakati. Ngai ni mwega hindi ciothe. Nyasaye ber ndalo duto. Nyasaye no mulai sindalo tiosi amujui. All protocols observed. Fellow colleagues, it's a great honor to stand before you as the chairperson of the Kenya Veterinary Board. I am brand new, 2.5 weeks old or something. Before I continue, can all the board directors please stand wherever you are seated, kindly? Dr. Sabenzia, you are somewhere, I saw you. Thank you. All the members of the Secretariat, Management of Kenya Veterinary Board, please stand. Thank you very much. You can have a seat. So, colleagues, I will start by thanking each and every one of you seated here today, and particularly those of us that at the tail end of last year answered the call and voted me as one of the 4 vet surgeons to sit on the board. Thank you very, very much for the trust. I will eternally be grateful. And to those colleagues that were not convinced enough at that time, no cause for worry. We shall work for all of us. To those colleagues that may be having some worries, I'd like to assure you that all is well. We have a great team at the Kenya Veterinary Board today, led by the CEO, Mary Teresa Agutu. She has new blood joining her. A lot of us for the first time. And I want to assure you that the board is in safe hands. I will not talk much. The team will talk through actions. Thank you very much.
So let's appreciate Dr. Mushibi again in a structured way, like, you know, the good, nice clap. Let's go. Thank you very much. So now allow me to welcome the KVA president, Dr. Kelvin Osore. Let's encourage him with a clap as he comes up. I think an encouragement clap would be random, eh? Yeah, like that. Yeah.
Thank you. All right. Thank you, Honorary Secretary. Colleagues, distinguished guests, thank you for this opportunity, and I'm very happy the room is full to the brim. I think we are worried that next year we might have to move to Bomas. I've been told I have 10 minutes. That is when I start my speech, but I haven't started yet. Allow me, colleagues, to recognize the Chief Officer for Kwale County, Dr. Joseph Jabu, and for him to just say welcome to us because we are in his county. Dr. please. So my 10 minutes haven't started.
Good morning. It's a bit intimidating to stand before doctors. Here, who are doctors in veterinary and also doctors because they have PhDs and professors. So let me take this opportunity, first of all, to convey greetings from Her Excellency the Governor, Honorable Fatuma Achani, who loved to be here today, but because of other work engagement, she was not able to come. I also convey apologies from the County Executive Committee member, Honorable Roman Shera, who also would have to come here. But because of other work engagement, he was also not able to come here. Have you forgiven them? Have you forgiven them? Because I need to take the message whether you have accepted the apologies or nation for conference and also, by the way, for leisure. For your information, before I go to my welcoming remarks, DIANI as a beach has been voted 8 consecutive times as the best holiday destination in Africa. Tupigeni makofi tafadhali. I'm told I have 1 minute. That is too fast. So before my 1 minute is exhausted, karibuni sana. I'm accompanied by the County Director of Veterinary Services, who is here, Dr. Amisi Mwalonya, who is, I know is a member of the Kenya Veterinary Association that is helping us in matters of animal health. I'm encouraged today that we have convened here in Kwale County to discuss about issues of veterinary medicine. And I'm also encouraged by the theme today that veterinarians, the guardians of food and health. So I am very hopeful that by the end of this conference on Thursday or Friday, these great minds that are here today will have given us a way forward on the kind of challenges that we are facing. And I'm encouraged by the discussion that I found here, the good professors and doctors that are discussing here on issues of vaccination, which is something that we as a country, we as a county, we need to make sure that we give a lot of emphasis. So because when my 1 minute is over, I wanted to talk much, but since my 1 minute is over, let me take this opportunity again to welcome you to Kwale. Please feel free to walk around as you also spend the rest of the week here. If you have some few coins, they are very great beaches, some very nice foods across the road. Don't spend all the monies here in the beach. You can also spend your monies on the other side of the town. So karibuni sana, and may God bless you as we attend this conference. Thank you.
So much. I'm informed the podium needs to be moved as we do that. Now. Can I have that microphone? So I want to... Okay, thank you so much. I want to also recognize, just for them to stand up and wave, the chief officers from other counties who are in the conference. Please just wave, Daktari, and you can tell us where you're coming from, if you can. Nandi County, Dr. Paul Sanga. Thank you so much, Daktari, and karibu. There's another chief officer at the back. I don't know if she's going to be heard, or do we need a microphone? Let's be a bit quicker. We are out of time.
Good morning. My name is Dr. Victoria Chalo, former Chief Officer in Department of Agriculture, but currently Chief Officer Public Service Management in the County of Makueni.
Thank you so much, Daktari. Thank you. Now, after that, are there any CEC's County Executive Committee members? Thank you. Let's start from, let's have another microphone at the end so that we move quicker. Thank you, Daktari.
Yeah. Good morning.
Good morning.
Yeah, my name is Dr. Lawrence Mongela, CCM, Tourism, Trade, and the Cooperatives, County Government of Isiolo.
Thank you, Daktari. Yes. Then there was another...
Good morning.
Yes.
Dr. Lo Joash, CCM for Agriculture, Irrigation, and Livestock Production, Homa Bay County.
Thank you.
Not a veterinary doctor, PhD.
Thank you so much. And we're happy to have you here. All right. Okay. So let me go straight to my brief speech, and then I'm going to recognize a few other important state officers after this. The DVS, the Director Livestock Policy Research, Dr. Wanga. Of course, the DVS, Dr. Alan Azegele, who is joining online. Distinguished guests, colleagues, partners, ladies and gentlemen, all protocols observed, good morning. Okay. It is with immense pride that I welcome you to DIANI today for the 60th Kenya Veterinary Association Congress. 60 years is a diamond jubilee. We've been around since 1966. And this demands celebration and reflection. Please, a round of applause. When I joined the office, I was informed KVA was initially only formed for, I want to use a sensitive word, a racially sensitive word, but it was not open to a native Kenyan vets initially until around 1966. So it is way older than that, and we've been here for a long time, and we are still standing strong. We stand today on the shoulders of giants, generations of veterinarians who since 1966 have traversed the farthest corners of this nation to safeguard animal health, protect our people, and anchor our national economy. But as we honor this past, we must not become anchored to it. Today, we are here to chart a new course. Our objective is clear, and that is the objective of a National Executive Council to transform KVA into a respected authority in science. We have said the last 2 years we have worked hard to ensure that we are in a position where we are the first call whenever somebody wants to discuss livestock, whenever somebody wants to discuss public health. Veterinary medicine is not merely a vocation, it's a rigorous scientific discipline. Every diagnosis made in Turkana, every vaccine cold chain maintained in the highlands, and every policy drafted in Nairobi must therefore be grounded in evidence. Yet, we must also be honest with ourselves, because for far too long, our collective voice as Kenyan vets has been a whisper, when it should have been a clarion call. We have been the silent healers. We're very good at treating animals. We're very good at doing our practice in the field, but we have been missing on the important tables. So these must end now. Our ambition as KVA is to harness the immense intellectual capital within this room. We are no longer just practitioners, we are data generators, we are researchers, and we are scientific leaders. We are hoping to transform KVA into a powerful powerhouse that informs public discourse, strengthens health systems, and drives the GDP of the country. Kenya currently also faces a perfect storm of biological and environmental challenges. That is climate change, which is ravaging our rangelands and altering disease vectors, but also zoonotic threats, reminding us that human health is linked closely with animal health. We also, of course, are facing issues to do with food security and international trade barriers. So we have to work to ensure that made in Kenya meat and dairy products meet world-class safety standards. As vets, we sit at the very heart of the One Health triad. We're the first line of defense. When we talk about AMR, we are just not talking about animal husbandry, but we're talking about the future of modern medicine. When we talk about transboundary diseases, on the other hand, we are talking about national security and international trade. We must show our value to the nation for us, for the work we do to be appreciated. Remember, colleagues, we've been talking about how, at the end of the day, there is a discrepancy between what our colleagues in the public service are earning compared to our peers in the in the health sector. And for us to ensure we earn and gain that recognition, we have to show our value to the nation. To lead, we must provide the North Star for the industry. And to this end, the association has taken two monumental steps towards that. One is evidence-based policy papers. We have moved beyond rhetoric. We've moved beyond mere conferences that do not come out with actionable points. Our recent policy instruments on animal health systems and food safety are not academic exercises. They are blueprints for the government and other stakeholders. Secondly, the revival of our scientific journal, something that you're going to see towards the end during the AGM. A profession that does not document its knowledge is a profession that loses its history. And because of time, I'm not going to read everything that is here. Now, I also just want to take a few minutes to talk about the power of partnerships for KVA. We recognize that no island can survive the rising tide of global health challenges alone. Our strategy is built on functional, high-impact partnerships that we have deepened with government agencies and private sector stakeholders. These are just not MOUs on paper. These are active collaborations on disease surveillance, animal health, capacity building, and laboratory strengthening. This is why our most recent partnerships are focused on economic impact and One Health. Take, for example, our MOU with KCB Bank and KCB Foundation under the Mfugo ni Mali program that aims to unlock the potential of the frontier counties by ensuring that livestock stays and plays its role in uplifting those communities. Secondly, our partnership with the government to deliver the Better Animal Health and Breeding Services program aims to boost Kenya's international trade, opening up access to markets in the Middle East and Europe. Our newest collaboration with government, and I'm very happy to see Enrique here with the rest of the team, because this for us has been a long time coming. Enrique, Kellen, and the rest of the team will tell you this discussion started with Dr. Muyale. And I don't know if Dr. Muyale is in the building. Yes, Dr. Muyale just wave. Dr. Nicholas Muyale is my predecessor, the immediate former chairman of the Kenya Veterinary Association. Yeah, my time is up. But you started when I was introducing people. Anyway, I'll be very quick. And so I'm very happy that actually we saw that partnership come into fruition. So our newest collaboration with GovMed targets an increase in moving the ruminant vaccine uptake to levels that will assure us of herd health and also guarantee public health. There are numerous other partnerships, including with the Kenya Medical Association, ATAC, whose officials are here, pharmaceutical companies and producers, among others. To all our partners here today, thank you. Your investment in KVA is an investment in the resilience of Kenya's livestock subsector. I am going to jump a few other lines because of the time. And in closing, I want to extend my deepest gratitude to the organizing committee. We have the NEC members who have been introduced. I don't know if the KVA Secretariat was introduced. Wherever you are, please just rise up. Members of the KVA Secretariat, thank you. I think most of them are outside, but we have Millicent, who is our administrative assistant. The CEO has already been introduced, Dr. Samson Michelule. There is Mary Malonza. All of you know Mary, our office admin. And then the remaining number of our secretariat are outside. I just wish to draw your attention to the fact that we've grown that secretariat from 3 to the moment. At the moment, we have 10 members of the secretariat. And the intention is to build the resilience of the organization. Thank you. Let us leave DIANI not just with the memories of the ocean, but with a renewed commitment. I was smiling when I was writing that one, just to show that I didn't use ChatGPT. To scientific excellence, strategic influence, and meaningful impact. Let us dare to be the authority the world and Kenya needs us to be. Thank you, ladies and gentlemen, and I officially welcome you to the KVA Congress 2026. Now my time is up. Allow me, colleagues, to introduce 2 groups of people, 3, if I may. The former chairman of the Kenya Veterinary Association. Where you are, just stand up and raise your hands. I forgot you, and it will be... thank you so much. We have 2 of them. I think I saw a third one. Oh, yes, there's another third one behind there. Please just say your names. I know you can shout. Okay, Dr. Victor Yamo is right there behind, followed by Dr. Nicholas Muyale, and then we can have Dr. Mutai. Dr. GK Mutai. I saw Dr. Kahariri around. Oh yeah, sorry. I keep forgetting he's a former KVA chairman. So we have Dr. Christopher Wanga, Director Karibu. Thank you. Now, I wanted to actually introduce him next, but I will allow probably his fellow director to do that, but I'll just introduce him to the audience. Dr. Christopher Wang is a Director Livestock Policy and Research. Thank you for gracing our event. So, colleagues, the CS was supposed to open this function, and then he was called to another official engagement under such a short notice. The DVS is in Brazil together with the PS, and he has been sent to officially open this function. It is now my distinct honor to welcome, I hope he can hear me, to welcome the DVS, the Director of Veterinary Services, and the Chairman of the Codex Alimentarius Committee, Dr. Alan Azegele, to officially open this Congress. Can we get him online? I don't think he is the one, but... he definitely is not the one. Thank you so much. That looks like him. Dr. Alan Azegele, the DVS and the chairman of the Codex Alimentarius Commission, I'm being reminded, the Codex Alimentarius Commission, is serving his 2nd term. Is joining us from Brazil. He will maybe just tell us what they are doing there. Dr. Azegele, if you can hear us, please, you're welcome to officially open this function. Can hear you a bit faintly, but you can proceed as we work on our volume.
I've just been notified that Dr. Wanga is there representing the Cabinet Secretary, and he was sent with an official speech. So I will allow him to open officially, but I'll make my remarks. So I want to recognize the presence of Dr. Wanga, representing the Cabinet Secretary, Ministry of Agriculture and Livestock Development, the representative of the Governor Kwale County, our host, CEC's chief officers present, Chair of KVA, who is Dr. Kevin Osore, I think very vibrant gentleman, and also the young blood that we really require to spark the key activities that we've been witnessing in the association. Distinguished guests, all protocols observed, good morning. I'm sending greetings from Rio. No, not exactly Rio, it's Sao Paulo, Brazil. I'm here with the Principal Secretary, State Department for Livestock. We are on a trade mission and actually appreciating what the Brazilian livestock industry has managed to do with the zebu cattle, having one of the largest population of livestock in the world and the fourth largest exporter of meat globally. I will carry the lessons learned and share on a different occasion, but today it's an honor to join you as we commemorate the World Veterinary Day and the 60th anniversary of the Kenya Veterinary Association, an institution whose legacy has profoundly shaped veterinary practice, policy, and professionalism in Kenya. This year's theme, Veterinarians, Guardians of Food and Health, is both timely and deeply relevant. It affirms the central role of veterinary services not only in animal health, but also in safeguarding public health, ensuring food safety, and advancing national economic development. Indeed, this theme speaks directly to policy priorities of our country. Ladies and gentlemen, distinguished colleagues, veterinary services are a critical pillar within Kenya's policy architecture. They underpin food safety systems, contribute to agricultural transformation, and facilitate access to regional and international markets. As a country, we have committed ourselves to strengthening the livestock sector as part of the agricultural sector transformation and growth strategy and the broader national development agenda. However, realizing these ambitions requires deliberate and sustained policy actions. First, we must strengthen our food systems. As you know, veterinarians play a central role in ensuring that food of animal origin is safe, wholesome, and compliant with national and international standards. This calls for a more coordinated and integrated farm-to-fork approach, supported by a clear institutional mandates and effective enforcement mechanisms. Secondly, we must invest in robust animal health systems. Disease surveillance, diagnostics, and rapid response capabilities remain fundamental, rather foundational, to protecting both animal and human health. In an era of increasing zoonotic risks, these systems must be modernized, adequately resourced, and supported by skilled personnel. Thirdly, we must address the challenge of traceability. As you know, we have developed the animal identification and traceability systems, and this, considering the trends globally, has been one of the key enablers to access global markets, since they become more stringent, and the ability to trace livestock and livestock product is no longer optional. It is a necessity. Strengthening traceability systems will not only enhance consumer confidence, but also unlock new trade opportunities for our country. Fourth, we must confront the growing threat of antimicrobial resistance. This requires stronger regulatory oversight, prudent use of veterinary medicines, and alignment with our national and global commitments under the One Health framework. Distinguished colleagues, the One Health approach must now move beyond theory into practice. The interconnection between animal health, human health, and environmental demands a coordinated multi-sectoral response. Strengthening collaboration between veterinary services, public health institutions, and environmental agencies is no longer a choice. It is an imperative. As we reflect on these priorities, we also recognize the invaluable role played by the Kenya Veterinary Association over the past 60 years. The association has been a steadfast partner in advancing professional standards, shaping policy dialogue, as the chair said, and advocating for the interests of veterinary profession. Its contribution to national development is both significant and quite commendable. Ladies and gentlemen, distinguished colleagues, as the Directorate of Veterinary Services, I reaffirm our commitment to strengthening the policy and institutional framework that support the veterinary sector. I'll continue to work towards enhancing regulatory systems, promoting public health partnership, investing in capacity development, and embracing innovation to improve service delivery. I also recognize the importance of aligning national and county level efforts to ensure effective, efficient veterinary services across the country. As I conclude, the responsibility of being guardians of food and health calls for collective action. It demands that we strengthen our policies, invest in our institutions, and uphold the highest standards of professionalism and integrity. So let us seize this moment not only to celebrate our achievements, but also renew our commitment to build a resilient, responsive, and future-ready veterinary sector. I congratulate KVA once again on the 60th anniversary and commend all veterinarians for their dedication and service to our nation. I wish you all a happy World Veterinary Day as we go towards it. And I'd want to thank you all for listening, and may God bless you.
Thank you. Thank you so much, colleagues. Yeah, thank you. Now, colleagues, that was our DVS. We prepared for one speech, opening speech, but we have a speech from the CS to be delivered by Dr. Wanga. We are going to receive the speech from the CS. Please allow us to follow that, officially receive the speech, and allow Dr. Wanga to make his own remarks in 5 minutes, because we are way behind schedule. We're to begin the second session at 11:35. So please, Dr. Wanga, if you may, please make your remarks, and then we will receive the speech from the CS.
Thank you, Mr. President. The Director of Vet Services, who is away, Chair, President of the Kenya Veterinary Association, distinguished colleagues, the leadership of the counties, good morning. I take this opportunity to congratulate KVA on this, pulling off a good meeting. Many of us have this feeling every last week of April, we don't schedule anything. Dr. Zegele will tell you we're all supposed to be in Brazil at this moment, but some of us is, in my mother tongue, we call it The Umsambwa of last week of April normally falls where the spirits of KVA are. So the temptation to be around was much higher. And allow me to bring the greetings of Waziri, who is a great friend of KVA. When he was not able to come, they requested me yesterday that I make remarks on his behalf, read his speech. So before I read his speech, I want to make a single observation. KVA is the engine of our profession and is basically the home of all, whether you're in active practice or tired and retired. And therefore, it's one of the organizations that all of us must belong, must share, and must protect so that we have the best coming out of it. If KVA doesn't tick, I can assure you the profession will certainly not tick, whatever much we can do. And therefore, the leadership of KVA, keep driving, keep working, because the entire population of the veterinary family heavily relies on you. The other day, Mr. President, when you are closing the nomination, I was a bit worried that nobody was opposing you. Because then my fear is that, are we going back to the 90s? But I think it's issues of the bar. You know, when you raise the bar also very high, guys shy away. But please, colleagues, let us not get into any level of lethargy. Let us support the organization because it will turn around very, very many things. And I can tell you with no fear of contradiction, as a former chair of KVA, many of the good things we achieved through the advocacy. And therefore, supporting KVA is not a waste of time. It is something that all of us must. And supporting doesn't mean you're in the executive. Even just being a member and paying your subs, that is full support. When they call out activities, you rally. And then for them, they can lead our advocacy at all levels. So with that, may I now read the remarks, the speech of Senator Mutahi Kagwe, Cabinet Secretary, Ministry of Agriculture and Livestock Development, during the official opening of the Kenya Veterinary Association Annual Scientific Congress on 22nd April 2026 at Diamonds Leisure Beach and Golf, DIANI. Ladies and gentlemen, I'm delighted to join you during the 60th Annual Scientific Congress, whose theme is Veterinarians, Guardians of Food and Health. It's a very, very appropriate for Kenya, which is driven by the bottom-up economic transformation agenda, implemented through the 4th Medium-Term Plan 2023-2027 of the Vision 2030. I hope through this Congress, we will have fruitful engagements and come up with proposals that will steer the Kenya's economic agenda through livestock sector and other animal resource industries interventions. I recognize the KVA for regularly organizing this Congress attended by vets, researchers, policymakers, industry leaders, development partners, and allied stakeholders to exchange knowledge, showcase innovations, and strengthen multilateral collaboration across animal health and livestock value chains. Ladies and gentlemen, I'm reliably informed that at the end of the Congress, you will offer free veterinary services to animals in this region during the World Veterinary Day celebrations, which will enhance visibility of the profession. Animal resource categories in Kenya are not just limited to livestock, but they include wildlife, farmed wildlife, companion and aquatic animals, and therefore addressing animal health, production and welfare, food safety, trade, are critical concerns that just straddle all the 4 sectors of livestock, wildlife, and fisheries. Ladies and gentlemen, animal health services are very integral in the prevention, control, and eradication of animal diseases that occasion huge economic losses and adversely impact livelihoods. Trade in animals and animal products require conformity to prescribed veterinary-related standards and application of sanitary measures that follow a farm-to-fork continuum. Provision of animal welfare is central to physical and psychological well-being of animals, animal health production, and it manifests through better performance, improved market access, safe and mutually beneficial companionship. Ladies and gentlemen, agricultural transformation is critical to growing the economy, reducing the cost of food, alleviating poverty, and therefore delivering 100% food and nutrition security, supporting industrialization and promoting exports. Millions of citizens depend on agriculture for income and food security, and the country's economic growth therefore depends on enabling these people to achieve food security and contribute more to the economy. The ministry is committed to implement the bottom-up economic transformation agenda, medium-term plan 4 of the Vision 2030, and this it has religiously done through the policy framework such as the agricultural policy, agriculture sector transformation and growth strategy, the livestock policy, veterinary policy, among others. Transforming the agricultural sector will provide tools to combat price volatility, improving the environment for private investment, and developing more strategic approaches to lower the country's dependence on food imports. Ladies and gentlemen, food security requires a vibrant, commercial, and modern agricultural sector that sustainably supports Kenya's economic development, national priorities, and commitments to the continental and global commitments such as CADIB framework, you recall the Kampala Declaration, and the Sustainable Development Goals. The government is finalizing development of a livestock master plan that will provide accurate data and information on livestock resources and available investment options based on the competitive advantages. This should help sustainable development of the agricultural sector. Ladies and gentlemen, critical flagship programs for this government are in leather and leather products value chain development, boosting productivity along the leather value chain, the dairy value chain, and ensuring that we double the milk productivity, especially the formally marketed milk, and also double our exports and value addition. Other interventions of interest include improvement of meat processing facilities, enhancing value for livestock for pastoral communities, establishing honey processing plants, livestock genetic improvement, large-scale commercialization of livestock feeds production and conservation, all aimed at improving availability and affordability of livestock feeds and averting feed shortages during drought. Veterinary services interventions in animal health and food safety are a necessity to deliver on these interventions. The government has invested heavily in training veterinarians, churning out graduates annually at certificate, diploma, and degree levels. And therefore, we should not experience shortages if you seize the opportunities available. As you are aware, vets receive training that focuses not only on animal diseases, but also on food hygiene, and they are therefore very competent to play their roles in areas food safety throughout the whole food chain. It is also important to recognize that you need to play your role in helping animal producers to avoid or eliminate hazards that pose threats to animal production, pesticide or drug residues in the foods, and also environmental management. I consider this Congress as timely and strategic in informing policymakers on potential areas that can be exploited to achieve sustainable and transformative development of the livestock sector. I wish to inform you that we have instituted several policy and legislative measures to create an enabling environment, and these include updating of the livestock policy and the veterinary policy, developing the livestock bill to address the unregulated industries, modernizing the Dairy Industry Act, modernizing the Animal Diseases Act and related laws. And we have, in this respect, we have the Animal Health Bill, we have the Animal Welfare and Protection Bill, we have the Veterinary Public Health Bill, and then the professional regulation, the veterinary surgeons and veterinary paraprofessionals supposed to give way to the Veterinary Practice and Veterinary Medicinal Products Bill. And then also in this respect, animal production professionals have a bill to regulate their practice. As I conclude, let me appreciate the strong collaboration between KVA and the ministry, which has enhanced the implementation of the National Development Agenda. We continue to engage the Salaries and Remuneration Commission on the appropriate categorization of veterinary services. I invite you to support the ministry efforts in building capacity on effective collection, management, and dissemination of agricultural sector data, where we are setting up a Kenya Digital Agricultural Data Information Center, also known as KADIC, offering digitally based data solutions. It's now my pleasure to declare this Congress officially open. Thank you, and God bless you as I wish you fruitful deliberations.
Thank you so much, Dr. Wanga. Colleagues, I think you've had quite a number of initiatives that we are pursuing, especially through the government, especially the last line on the Salaries and Remuneration Commission. Those efforts will be highlighted during the AGM, so don't worry about that. Once again, thank you, Dr. Wanga. Thank you, Dr. Azegele, for gracing this occasion and for representing the CS, specifically Dr. Wanga. Now, colleagues, there's only one thing left in the opening ceremony, and then we can proceed with science. I want to invite the CDVS, the host CDVS, Dr. Mwalonya, and the Chief Officer to receive a gift, a small gift from KVA, the Honorary Secretary and the CEO. Okay. And then we can proceed with science. Karibu. This is to just say thank you for hosting us. You hosted us, as you said, last year for the World Rabies Day, the year before. You have been great hosts. And guys, enjoy DIANI, as Dr. Jabu said. A round of applause, please. Thank you. Yes, another round of applause for the CDVS. Asante. Thank you so much. Thank you. Asante. So colleagues, once the chief guest has spoken, there is nothing I should add. So I really want to take this opportunity to invite the moderator for the second session. That should be Dr. Kellen Asena. We are running way behind time. We were to begin at 11:35, so we are 40 minutes late. So we will try and rush the event, the session, but please bear with us. Thank you.
Thank you, President. Well, in the morning, we talked around and discussed and deliberated on matters, the importance of vaccination uptake in ruminants, and why we need to be able to strengthen livestock system and for it to be able to safeguard livelihood ultimately. This next session is just a build-up of the session we had in the morning, and this is to give us an opportunity to discuss the solutions themselves. These solutions are not just products, they're actually essential tools for improving productivity, resilience, and economic outcomes along the livestock value chain. Now, in this session, we'll be looking at commercial partners, so partners who are actually involved in production, in development, production, and ensuring availability of these solutions. And to open this solution, I would like to welcome Dr. Alex Sabuni, who is the Managing Director of the Kenya of KVA. Thank you.
Guest of honor, represented by Dr. Wanga, who is my mentor, all invited guests, ladies and gentlemen, good afternoon. I'm just going to have a discussion about the veterinary industry, veterinary vaccine industry in this country. And I've not been informed how many minutes I have. 10 minutes. Thank you. So I would want us to just engage in a bit of mind-boggling session about where the animal health industry is coming. Where are we from? Currently, where are we standing and where are we heading to? And I did not have a formal presentation, but I would want us to have this discussion. And I'm been invited here to discuss about innovation in veterinary vaccine in this country and maybe in Africa. Remember that Kenya and Nairobi is the gateway into Africa. And that is why everybody has a lot of interest, whether it is in IT, whether it is in petroleum, whether it is in human and veterinary vaccines. And everybody is trickling to Kenya to try and find space so that they can now build a niche into Africa. I work with an organization called the Kenya Veterinary Vaccines Production Institute. I've been there for the last 4 years. Before that, I was with Narok County government, and I've worked with several other organizations. I know that within us, we have men and women who understands animal vaccine far much better than I do. Some of them have worked in KVA. I have the former managing director among us, Dr. Mutai, who is played a major role in transforming KVA when KVA was working with GovMed, and it led to transformation in terms of modernizing our infrastructure. Also with us here, we have, I'm with my board director representing the principal secretary, Dr. Romona, and the technical staff. Where is KVA coming from? Remember, when the human vaccines are now trying to set up, fill and finish, and putting their human resource together and raiding on KVA to get technical people. For 60 years, we have been manufacturing veterinary vaccines. And what does this tell us? That we have had technologies that have been leading in Africa to produce veterinary vaccines, and more especially the foot and mouth disease vaccine. This has been, I would want to put it very clear here that foot and mouth disease vaccine is very political and very controversial. And it is the reason why KVA has been on the receiving end because of the interest around foot and mouth disease vaccine. I'll go there when we'll put this discussion in perspective. But where has animal veterinary vaccines come from this nation? Remember, the Director of Veterinary Services was manufacturing vaccines. Kenya Agriculture Research Institute, KARI, was also manufacturing vaccines. And these are the two main arms, together with Wellcome Trust Foundation, that gave birth to KVA. Earlier on, the DVS would buy vaccine, distribute to districts. The districts will do what is called a strategic vaccination in those based on the risk maps. And with the time devolution came in, at the beginning of devolution, there was a an increased demand for veterinary vaccine. And Dr. Mutai can confirm with me. But later on, the interest of the devolved systems changed the fortunes. They realized that this was more of a service and not a hardware, and the investment into animal vaccination went down. But later, changes emerged, and when this national government came in 2023, we realized, and all of us have been in the country, and we have witnessed a tremendous interest in veterinary vaccine manufacturing. Some of us here as professionals have thought it was not very genuine, but now you can see the kind of investment that is being put into promoting animal health in this country. And largely, His Excellency, our President, has confirmed over and over that there is market for meat and meat products, but there is only one major limitation, which is the animal diseases. And that is what has driven Kenya and many other countries to get into national mass vaccination. I would just want to give a few examples. And one example I'll give, apart from Kenya carrying out national mass vaccination, is Tanzania in June last year when we were there. The president in an area called Simiyu, she launched national mass vaccination. We've had vaccination again in Uganda. Uganda has been the biggest uptaker of KVA vaccine, more than Kenya has done. We have also Zambia, which advertised huge tenders for veterinary vaccine procurement. We have had Mauritius, the same. We have had South Africa also. Recently, they had what the president in South Africa announced as national disaster of foot and mouth disease outbreak. And so everybody is getting into veterinary vaccine, vaccinations. And this is a good opener because largely it is opening up markets for Africa and African products, for livestock and livestock products from Africa into Gulf countries and other markets abroad. So as Kenya, where do we stand? We have a very good opportunity, and that is why we are here. And for our whole morning, we have a dedicated session to discuss about veterinary vaccine, especially ruminant vaccine, advancement and acceleration of the uptake. We have partners who have come in. I remember many of us have been asking, where do KVA stand in this? And the best example I normally give is the poultry vaccines. The poultry vaccines, when we look at the evolution, right now nobody is pushing farmers to vaccinate against poultry diseases. Why? Because there has been a lot of awareness creation. And that is where we are driving, all of us are driving towards. But also it is very, very important for us to note that as we drive this veterinary vaccination in this country, a question that has been asked when we've been doing national mass vaccination is, do we have the capacity to monitor the performance of these vaccines? The Director of Veterinary Services has been monitoring the performance of FMD vaccine effectively with the resources. What about these other vaccines? We are quickly moving into innovations, but are we in terms of surveillance? Are we in terms of monitoring the performance? Are the regulators also moving with the manufacturers as we move into these new technologies? That is a question that we will have to ask ourselves. As I finish, I would want to say that at KVA, we are looking at innovations because the landscape has changed. There is an increased demand for veterinary vaccine. There is also a lot of push in terms of getting us transform our business model for us to be able to be as more proactive and farmer-led to ensure that there is increased vaccine uptake, coupled by the support from our partners. And what we are doing, we are working with partners to ensure we accelerate innovations in areas of veterinary research. We have now oil-based foot and mouth vaccine that is now on the market, which our evaluation has projected more than 12-month projection. We are at the trial stages, which we will now officially launch and invite you people in such a forum. And this is one of the great innovations, because I can confidently say before this crowd that KVA in the whole of Africa will lead in terms of human resource capacity in foot and mouth disease vaccine production. And a good example is our neighbors in Uganda. Go and ask them. They're buying vaccine from 7 companies. What is the premium vaccine in Uganda? It's KVA vaccine. Now, when you talk of high quality vaccine, where do you put all of us? That is where we are driving at. We are contributing to the high quality vaccine as KVA. Another thing that we are focusing on, we are working with organizations like Drop Access to have innovations in the transportation and delivery of veterinary vaccines, and where they have something that is called VaxiBox, which is a solarized, transportation cooler box for vaccines. We are also working towards with several partners to ensure that we have more better advances in delivery of vaccines. We are working on Brucella vaccines. You remember there are eye drops. We have the Pasteurella vaccine, which is for spraying. And these are the delivery innovations that we are looking at to make vaccination much easier. And as I finish, I would want to say that one of the diseases that has been mentioned here, which is CBPP, is a very interesting disease. Why? Because our routine vaccine, we deliver the tip of the tail. But I'm very sure that other partners here have supported to come up with innovations where it can be delivered in other areas of the animal. And that is where we as KVA, we realize that by working alone, we will not be able to move and advance much faster. So we are collaborating with several organizations. We have also the capacity to support in the vaccine performance monitoring as KVA, having more than 60 years of experience. And that is why we are asking all of us, why can't we work together? KVA is there as a common user facility for all of us to use. Last but not least, KVA, we have focused as a long-term plan to build a new factory. And we have a lot of support from the government. And so soon, let it not come as a rumor. It is plans, the government have plans to build a new state-of-art facility. And that is where we are heading to. And we are positioning ourselves based on the experience of COVID to ensure that we build our local capacity first. Because in the event we have outbreaks out there, even our partners who are bringing here vaccine, their governments.
Thank you so much, Alex, MD, KVA. Those are indeed good insights about what KVA is doing and the way forward in terms of vaccine production and delivery. So our next speaker is Professor Ahmed Al-Majali. He is from Jordan University of Science and Technology, and he's going to be joining us virtually. He's the WOA regional representative for the Middle East. So I think the IT team can put him on. He's going to be speaking about epidemiology and burden of PPR, SGP, and CCPP use of a novel trivalent vaccine.
Yes, can you hear me?
Yes, we can hear you. You may go ahead.
Yes, first of all, good afternoon, and thank you very much for inviting me. I've been following as much as I can this conference, and I've seen a lot of colleagues that I did not see for quite some time. So I'm sorry that I was not able to be in person with you, but it's due to an illness that I'm currently suffering. And I would like to say that actually we have a sub-regional office in Nairobi for WUA. I hope that they are attending this very important conference. Well, as you see that I'm the WUA regional representative for the Middle East, but before I've joined the organization, actually I was a professor with Georgia University of Science and Technology and still a professor there. But at that time, I've worked with the vaccine industry on several projects, and one of those projects was implemented with GalVmed and JOVAC. But before I proceed, I would like to say a few words about the PPR, sheep and goat pox, and CCPP. As you know, that those are quite important transboundary animal diseases that affect livestock trading, especially between Africa and the Middle East. And here we are talking about your biggest market, which is Saudi Arabia and the rest of the GCC countries. Millions of dollars or probably billions of dollars of industry is involved here. So without any delays, because I know that you are behind in the schedule, so I'll try to be fast and just jump on things that are common sense. But those diseases are basically quite important because they are highly contagious and they cause high economical losses, and they affect livestock trading, and they affect the livelihood of small farmers, as they're causing direct losses, huge direct losses, and quite basically substantial indirect losses. And those diseases are of global importance for like international organizations such as FAO and WUA. And we recognized certain dates for eradication of those diseases, but I think we are very optimistic here because we are talking about 2030 to eradicate PPR, which seems to be a little bit difficult now as we are approaching this year. When we talk about PPI, you all know that this is a quite important disease caused by morbillivirus. But the lucky thing that currently there's only single serotypes with different basically lineages. And the transmission is through the direct route. But from epidemiological point of view, we have not recognized the disease or this virus to cause carriership, which actually make it easier to control. But this is a multi-systemic disease, as you know. As for the epidemiology, you see that it is reported in Africa, across Africa, in the Near and Middle East, and in Asia. And recently we've started seeing some cases in Europe as well, which grabbed the international organizations and the international community attention. And now they are thinking of really using vaccines, especially producing vaccine banks that are ready for use whenever it's needed. As I said, the eradication goal is to eradicate this disease from the globe by 2030, which is basically now very kind of a target that may not be achieved by that year, but we need to revisit this program, which is the stepwise approach developed by the PPR Secretariat, which is an FAO WUHA group, and they have produced the PMAT, which is a self-assessment where they put countries in certain perspectives and where they are within the global eradication plan. As for the CCPP, which is a quite important bacterial disease caused by mycoplasma, which make it very difficult because it is highly important from economical point of view, as it causes about 100% mortality. So pretty much every animal get the disease usually die. The importance of this disease comes that it is found in East, West, and North Africa and the Horn of Africa, some countries in the Middle East and South and Central Asia. We have included this disease within the PPR Secretariat as a disease that is similar to PPR from pneumonia perspective. And we start thinking of it what kind of things that we can do in order to eradicate this disease. And many recommendations came up that it should be included in the PPR pox eradication plan. As for the sheep and goat pox, this is a disease that is endemic in Africa, North Africa, and the equator, and in the Middle East, and in certain parts of Europe and certain parts of Asia. And this disease is caused by a Capri pox virus, and it's usually basically spread by close contact, and it affects livestock trading, and recently been basically grabbed the attention of certain countries in Europe, especially Greece and Cyprus. And we started actually thinking of getting the vaccine there as a plan to control this disease. The question here is, what are the risk factors for all these diseases? And we see that they have common risk factors such as high contact rates, mobility and markets, and the use of livestock markets without biosecurities, the use of communal resources such as shared grazing and other basically needed or lead to head contacts. Immunity gaps, as the vaccination coverage is not fully practiced by all countries in the region and sometimes even within the same country. The problem with diagnostics and this comes into like two things: availability of diagnostic and diagnostic materials and equipments and whatever needed to diagnose, and the capacity of the staff, how much they are trained in using these equipments and these kits to diagnose diseases. Sorry. So when we look at morbidity, mortality, and susceptibility, we see that the CCPP has the highest mortality, as almost like, it causes a mortality from 70 to 100%. And PPR, the same thing, but the mortality in PPR may reach 70%, especially for youngs. The sheep and goat pox has the lowest mortality, but it has a relatively high morbidity. For control, all these diseases are controlled by vaccination. And in case of PPR, we use two main strains, but the one that is used in Africa and in the Middle East is the Nigeria 75-1, which is actually the best strain known so far, and it's been working very well. For the CCPP, currently they used vaccines, they used inactivated vaccine, but now more attention has been drawn towards using of live attenuated vaccines, or actually live vaccines, but under certain circumstances. And for the sheep and goat pox, the live vaccine, and we have different vaccines in the market from different basically serotypes, but the 0, 20, 40 is the one, 240 is the one that is used as it is a sheep and goat pox virus. So early detection and reporting is very important. Movement control is quite important as well. Cleaning and disinfection and other biosecurity issues. And we talked about the global programs, which is the PPR, Global Eradication PPR, and we have included in this program other small ruminant diseases such as CCPP and sheep and goat pox. So let me just jump to this because this is very important, along with a project that is basically show a great collaboration between the industry and as well as organizations and the private sector. we developed a Jovac vaccine, a trivalent vaccine, basically, and this vaccine was tested in laboratory, and then it was tested in the field in Somalia. So I'm going to just show the results that we did in Somalia, basically. But the reason that we did this vaccine, because we noticed that there's a problem with using monovalent vaccines, as it has a burden in delivery of the vaccination, and it affects roadmaps as it increases the costs of vaccination. And by combining the three vaccines, we were able actually to reduce the cost and basically make per delivery, as you visit the field once, to deliver three different protection for three different diseases. So we tested the safety by monitoring local and systemic adverse effects, including measuring the body temperature as a trend, if there's any side effects or any basically unwanted responses to the vaccination. Then we tested the serology by doing serological responses, immunogenicity by doing serological responses, but at 4 different time periods. And then we tested the kinetics of these antibody responses. So this study was implemented in Somalia and in 3 different villages. And we choose the goat as the animal target animal, and we choose the age of 4 to 6 months old, basically as young, because those are the most vulnerable animals to get the infection. We tested them for basically being exposed to any of these viruses or the CPP, and they were negative at day 0, and that's actually the inclusion criteria. And we aligned those animals into 2 groups within each village as vaccinated and controlled, 30 animals vaccinated and 10 animals controls. And actually we ended up vaccinating all animals in the village, but we left animals as controls. And we monitored those animals closely, basically, for any side effects. Temperatures were taken for 7 days on daily purposes, and we recorded any changes. And then we sampled them at day 0, 14, 30, 60, and 90 days post-vaccination. So the vaccine that is used, it was a trivalent.
5 minutes.
Yes, we call it the combo. Yeah, about to finish. We call it Jovac combo. It contains Nigerian 75-1 and the sheep and goat basically pox, which is the Kenyan actually. It's 0-2040. And the CCPP Mycoplasma capricolum subspecies Capronamoni. So the immunology that was done, we did the ELISA for the PPR, the IPMA, the immunoperoxidase monolayer assay for the sheep and goat pox, and the competitive ELISA for the CCPP. So for the body temperatures, first of all, no side effects at the injection site were noticed, and no changes in the animal behavior, eating pattern, or any disturbance were noticed in those animals after vaccination. And when we measured the body temperatures, no changes, no significant differences between the vaccinated and the controls. And when we tested the immunological reaction by the different tests that I've mentioned, we've noticed that all animals actually start showing antibodies, protective antibodies, hopefully, at 14 days post-vaccination. And at 30 days post-vaccination, all animals, actually in all groups, were seropositive for the 3 different antigens, for the PR, the sheep and goat pox, and the CCPP. And they remained high until the end of the study. So the initial basically appearance of the antibodies were at day 14, suggesting that these vaccines actually have start producing antibodies necessary for protection at day 14. So the key conclusions here that the vaccine is safe and it produce rapid onset of detectable immunity, especially for PPR, and the fact that they remained high suggests that this vaccine actually were able to produce the needed immunity for long period of time. We are actually following some of those animals and other studies to make sure what is the duration of immunity, and we believe it's quite long, at least 1 year, basically. As a general recommendation, it's very important to integrate a single shot trivalent vaccines in the country plans to control diseases. It's very important to strengthen the cold chain and handling SOPs, as those vaccines are vulnerable to the changes and to environmental conditions. Keeping in mind, actually, the combo vaccine is highly stable as it's tested in the lab, and this is actually a technology where we've used a special stabilizer. The paper is published. This is a work that was done by GalvMed, the Jordan University of Science and Technology, as well as Periprite, where we actually evaluated the stabilizer on PPR, and we tested in the field. And basically, this concludes my presentation, and I'm willing to receive any of your questions. Thank you very much.
Thank you so much, Professor Al-Majali, for that interesting solution available by the JOVAC group. Our next presenter is Dr. Surajit Baxi. Dr. Surajit is a veterinarian. He holds a PhD in veterinary microbiology. He's published over 70 research papers, and he's currently with Hester Biosciences as the Associate Vice President. Welcome.
Thank you for the brief introductions. Good afternoon to all. It is my pleasure to be here at Kenya, this galaxy of veterinarian. And I would like to thank you, this KVA and this GalMeds. Thank you for giving me the opportunity to take over here. I represent Hester Biosciences. So Hester Biosciences, our mission is that better health of human being to healthier animals. So it is aligned that if the animal health is good, then it should be for better health for humans. Visions building the future on a foundation of excellence. Core value, our integrity, innovation, passion, discipline, and trust. So in Hester Biosciences, we have these divisions to poultry healthcare and animal healthcare. In poultry healthcare business, we have all vaccine against the poultry diseases. It includes Newcastle disease, infectious bronchitis, Marek's, smallpox, all these diseases. And we are also in formulations, health products. It's basically feed supplement, therapeutics, and biosecurity parts. In animal health, we have the vaccines against PPR, goat pox, lumpic skin disease, CCPP. Few of them I mentioned here. We have also division of formulations, and that is feed supplement, therapeutic, and biosecurity. We have also pet care divisions for our beloved pets, dogs and cats. We have feed supplements, we have therapeutics, and we have some cosmetics for our growth. So Hester have 3 plants. One plant is our India, near to Mumbai. It is single location, largest plant in Asia. We have one other manufacturing unit at Nepal, that is near to Kathmandu. Now we see our plant in your Africa, that is near Dar es Salaam, Tanzania. It is now operated, and so we are here for giving this all ruminant vaccines. We are producing CCPP, CGPP, LSD, all this type of and single vaccine and combinations we are doing and supply to our Africa specific diseases. So this plant is built to remove these African diseases. You know that as per law of the soils. So like example, Hester is the only organizations we having 2 different strain of vaccines for PPR. One is Nigerian strains we are manufacturing here for the African country, and another is our Sungri strains that is in India and other part of the Asia. Similarly, lumpy skin disease, Nettling strains that is for your Africa. If you go to the India and Asia, that is this Rachi strains. So this is the only organizations in the world, I may say that. This is all the combinations as for this law of the soils and this virus transmittance. We are providing the solution to the country. So we have the patients entire globes. We have more than 35 countries in Africa and Europe. We are supplying vaccines. And yes, with this, our great Galmet partner, Dr. Enrique is there. And we are closely working with that. So Vital 2 project for this Kenya, Tanzania, and here Nigeria. So here I just mentioned that we are the largest PPR vaccine supplier for the WOW eradications, and we are the partner for that 2030, the PPR should be eradicated. Second disease in history of animal science after re-enter pest. Then LSD vaccinations, yes, we're going. In India, for just for your academic interest, in India, so last 3-4 years, there is a huge outbreak of lumpy skin disease. So for these emergency uses, goat pox, we have that, Indian strains. That is repurposed for this lumpy skin disease for this last 3 to 4 years. And cattle is survived, and it is more than 95% efficacy. So we give the vaccines in India for the repurposes of goat pox in lumpy skin disease also. And second, where the poultry is largest in India, 35% market shares, and we have the strong R&D. We are doing next generation vaccines for the recombinant vaccines for the poultry and animal health also. We are also R&D in good facility for our Tanzania plant. We are working closely with this Galmet for this recombination vaccines for 3-4 in one sorts. So I come to the point now. So in the morning, all scientists is talking about these transboundary diseases. So yes, it is really difficult to manage these transboundary diseases. So one of the part of not that transboundary diseases, sheep and goats. So important of the sheep and goat in Africa, yes, it is. Sheep and goat in Africa agriculture providing the food security and food safety, and million on same-holder and pastorians. As highly adaptable stocks and meal, it should be rural communities. So transboundary diseases leading to, there is 2 major impact. One is hamper food security and income. And second one is economic livelihood that will be impacted by the transboundary diseases. So transboundary diseases, highly contagious diseases, cross the international border, and crossing the rapid and strong livestock population trade human health and cause sometimes the zoonosis. So here it is, one is PPR, Pesticides ruminant. second C1 got pox. So for your just informations, in India, in ICA also, there is 2 different diseases. One is for the sheep, one is for the your goat. So goat pox is caused by the goat pox virus, and sheep is caused by the sheep pox virus. So here it is good that within one single virus, sheep and goat pox, Kenyan strains, that will work for both these species. So it is good. So with the one virus we can cater both these species of the vaccines, and the Rift Valley fevers and CCPP, contagious caprine pneumonia. So management of the transboundary animal diseases is the synchronized vaccinations. Yes. So vaccination is the key for that. So especially strategic vaccinations and before the seasons is most important. So when there is a monsoons, there's a lot of your vector is there. So vector is also transmitted by the diseases. So before that, we should vaccinate our flock properly against this PPR and CPPP and next Rift Valley fevers. Quarantine is also most important. Whenever take any animals from the other parts, so it should be strictly quarantined this animal. Don't directly put into your other part of animal to your flocks directly. It should be in quarantine to control the livestock movement of the disease. Cross-border surveillance, yes, it is very, very important part to control the transboundary diseases. So when it is essential to prevent outbreak, we should cross-boundary diseases. We should do the seroprevalence. Yes, most important. Any vaccination is not only the ultimate tool to eradicate the diseases. So we have the experience of rinderpest. So in the morning also we are discussing a lot of things, this seroprevalence and prophylaxis and the seroconversions. So after vaccination we have to do a lot of things. What is this seroconversions? It is the natural infections or the vaccinations. If it is vaccinations, how long it will be there to prevent the diseases. So we have the solution for that already. We have registered this product in our Kenya. That is the combination vaccines of PPR and SGP. The strain of the PPR we are giving for this Africa, that is their Nigerian 75-1, that is your interested strain since eradication program in your African continent, and KSGP, that is 0810 strains. So these strains for this, especially for the Africa, and we are manufacturing this vaccine from your African friend, that is in Tanzania, state of arts. I request and I invite you all of please come to visit us in Dar es Salaam. So PPR, it is a vaccines produced in our expertise. It is a cell culture vaccines, Verocell adopted, and it strains 175/1 Nigerian strains and KSGP for 0180 strains for that, and it is formulated in lyophilization form. So we have the expertise for this lyophilizations for so many years for our vaccine technology. We have the strong R&D. So we are giving this stabilizer in that fashion that, and make this lyophilization cycle in that fashion, so it should not interfere or should not give this others to your vaccines. Yes, 5 minutes. Thank you. So regimes for reconstitution vaccine. So each dose contains not less than 1 × 10⁻².5 when there is a combination. So PPR also 10⁻².5, TSCRT 50, and SGP also 10⁻².55 dose. It is recommended for both the species above 2 months of age, and vaccines cost is breeding seasons before that. So safety is concerned. Sometimes we in mind that whenever 2 strain is giving in the one species in single injection, so it should be safe. There should be not be any between virus contraindications. So 2 virus cannot giving something wrong in the systems. So any vaccine development in this vaccine technology, we are there. So first of all, we have do some lab test that is called the guinea pigs. We testing of the guinea pig at the field dose, and we giving the control and observation of 21 days. This is all for your pharmacopoeial requirement. If you go for hair and wow requirement guideline also there. So we are doing maintaining these guidelines. And then is mice models in each and every batches whenever produced in our vaccines before going to the market. So we are doing all these tests. So it should not be causes any adverse on safety issues in species. So second is host safety. Yes, it is most important for the host safety, but nowadays, as per European pharmacopoeia, sometimes we can omit that in the host safety due to these animal ethics committees and use of the less of these large animals means ruminant to our experiment. Still, as per WOW guideline, we are doing the safety in the host. So we are taking the sheep and goats for the safety study, and it is safe for 21 days. We have our veterinarians, we are reporting that. So the most important thing is efficacy. Yes, for efficacy studies, what is the golden test is a challenge study. So in every batch, we are doing these studies. We are doing these vaccines to the sheep and goats. And after 21 days of the study, we give this challenge virus, means the field strains, which is available in your country. So challenge, and we giving this control is infected and vaccinated is there is no infections. So it is the golden test at any vaccines. For that we are doing, and we are supplying these vaccines before marketing and testing of that. So second thing is the feature of the live PPR vaccine. So it is the safe and efficacious. We can go for the mass vaccinations. We are doing also field study in the fields and single dose 2 disease. For the immune response, we have done that, and we have this due to this time and all this I have not mentioned here. We have the study data for this 1 year. As per this goat pox, it is giving good immune response as per the your SNTs, serum neutralization test, and the PPRs is giving 3 years for our response for that. Your ELISA titer and SNT titer. So immune response also good for both these combination vaccines when we give, and in the comparative study also you have the single monovalent vaccines and the combination vaccines. So it is equal response in response of these combinations and single vaccines. So this is safe and efficacious vaccines, and we will be the part of your eradication program for PPR with these combination vaccines in sheep and goats for your continent. And for yes, it is also in India also we are giving this vaccine that is in different form. That is PPR and goat pox, that different strains. So vaccination is a central control for the TDS. Yes, we need these vaccinations. So I am also going to close, and thank you for instructing me time by time. So otherwise, thank you all. Thank you my presentation.
So thank you, Dr. Baxi, for your good presentation on the good work that Hester Biosciences is doing for ruminant health. So our next speaker will be Dr. Hamratu, who is a technical and marketing manager for MCI Sante Animal. He has interest in infectious disease management, vaccination protocols, and herd health program optimization. Welcome, Dr.
Minutes. Oh my God. They told me I have 20 minutes, but I will try to do my best. Hello, everyone. So my name is Taha Hamratu. I'm a vet. I'm from MCI Sante Animal, Morocco. So maybe I will go straight to the point. What I'm trying to, or what I'm willing to present, it's the combo MCI combo vaccine or solution, which is named Bovivax LSD CBPP. So the development of this vaccine, it was in a collaboration or partnership with GalMed. So the first idea was it's to have a combo solution or one vaccine that can bring a solution for the most populated or the most prevalent diseases in sub-Saharan countries. And after that, so the decision, it was done by choosing 3 diseases. It was the CBPP with the strain T144, the LSD with the Nettling strain, and RVF with clone 30 thermostable strain. So each strain, it was developed separately, and after that, It was mixed before lyophilization, and the combination were tested in vitro and on animals. But biology it's not like mathematics. 1 + 1 + 1, it's not always 3 in biology. So the challenge here that during the development of this combo vaccine, RVF and LSD, they show an interference, and thus was published as the first discovered in the time of the science. So what was the solution is to bring the two solutions that can be injected in the same day, but in 2 sites of injection. So Bovivax LSD CBPP with Mycoplasma T144 strain and also the Netlin strain. And you can add also in the other side of the neck the Riftovax Clone 13 thermostable. So what I'm going to explain or to detail more, it's the combo vaccine Bovivax LSD CBPP. So for the composition, it's a live attenuated lumpy skin disease virus, Netlin strain 10 to 4.5, and Mycoplasma mycoides T144 strain 10 to 7. So for the dosage, it's 2 ml per animal, administered subcutaneously with the annual booster. So for the administration, it can be done at the neck level without any problem. For the presentations, it's 10 doses, 25 and 50 doses. So for the antigen production, so both strains, LSD and CBPP strains, were produced under GMP standards. So with high technology process, vaccine formulation using an optimal lyophilization process, and also quality control during the production, and also for all the batches regarding sterility, purity, safety, and titration. So what about the safety and efficacy laboratory studies? So for our case, as Morocco is non-endemic or it's free from LSD and CBPP, all the immunogenicity and safety tests were conducted at our labs level, and all the challenges tests were conducted in reference labs. So for the safety, we can show that throughout the monitoring period, which is 14 days, no abnormal behavior or deterioration in general health status was observed. A slight increase in body temperature within the 2 next day or 3 next day post-vaccination, which is normal and which is a good sign for the immunological system. And also a transient local reaction, it was observed at the site of injection within the first week post-vaccination, and it doesn't exceed to 3 centimeters as the diameter. And also, one of the recommendations of the European Pharmacopoeia is to test your vaccine 1-time dose and 10-time doses. And this is show us how the product or how the solution, how much the solution is safe to use. So also another point is the safety in pregnant animals or pregnant females. So during the period of the test, no alteration in general health of the females, and no abortion were recorded until the parturition, and with no malformation or congenital malformation in newborn calves. So for the CBPP valence or CBPP parts, this photo is from the Calro Institute. So for the CBPP response or immunogenicity, we can see that we compared the 2 solutions, the combo vaccine and the monovalent vaccine, and we can see that there is no difference at day 7 between the 2 solutions. So there is no difference between a combo vaccine and a monovalent vaccine. And also in day 21, we can see that we reach a good level of seroconversion, 100% for monovalent vaccine and 96% for combo vaccine. So regarding the challenge, maybe I should skip this slide because it will take a lot of time, but the most important that we did a challenge within 13 months. So just to prove the duration of immunity, and we did it on 2 points, at 6 months and also at 13 months. So the challenge model, I think that this challenge, it was conducted by Dr. Ezron, and it was a new model that used more or less a rush, how can I say it, challenge with 10 to 9 per ml CFU, which is a high level of charge. So for the safety results, so no local reaction at injection site has been reported in animal vaccinated, and even with the monovalent or bivalent vaccines, and all vaccinated and unvaccinated model remain in good health. So for the efficacy and duration of immunity, so we have 2 points. The 6 months, we have as a result 50% of protection, and at 13 months, we have 81% of protection. So as a conclusion, so using Lesion score for assessment, the results for study are quite interesting. So, and also the multivalent vaccine show an efficacy more or less equivalent to monovalent vaccines. And the challenge used in this trial is under discussion because we think that it was very harsh, but despite we get good results. So for LSD valence, the challenge was conducted in CFIA, the Canadian Agency of Inspection Food. For the immunogenicity, we can compare the two solutions, the monovalent and the bivalent vaccines, and we can see that there is no significant difference between the two solutions, whether at day 7, day 14, or day 35. And also another point related to LSD, all of us as a vet, we know that for LSD, it's a cell-mediated immunity. So we need to quantificate the interferon gamma to see what is the response of our vaccine. So we found that we have a positive interferon response, 88% of calves for the monovalent vaccine and 71% for the combo vaccine. So the challenge was also conducted in the same laboratory in Canada, and we can say that we do not have any local reaction at the site of injection. And for the serological response, we see that only 2 from 8 vaccinated calves develop neutralizing antibodies. This is not something strange for LSD. We look more for results of challenge than antibody response because it's a cell-mediated immunity. So for the challenge, for the vaccinated group, we have a total protection with a good health, no hyperthermia, and no clinical signs after the challenge, no viral shedding, and no viremia. And this was done due to oral and nasal swabs after 21 days post-infection. With the control group, we see some hyperthermia, severe clinical signs, and also viral excretion within the next week after the challenge. So as a conclusion, this is the conclusion of the reports from the CFIA agency that said that under the condition of this field study, vaccinated protocol manufacturer, we can see that even we don't have antibody response, we still have protection against challenge. So all this data that I have showed you is published under this paper. You can find it in Vaccines Journal. So for the products, I can say that it's under registration in Kenya. It's the result of R&D development in Vital One, as Dr. Enrique said before, and we are in the process of registration in Kenya. In the other hand, it's already registered in other countries in West Africa. So to conclude, I can say that Bovivax LSD-CPP is efficient, complete protection demonstrated by challenge, which is more important and significant related to kinetic antibodies, studies, prevention of post-infection shedding, no virus spread regarding LSD, safety, it's safe for females and also at local site of injection. And the most important thing that when you bring a combo vaccine, you have a lot of solutions within one injection, and it's reduce stress in animals, and also it's reduce labor costs associated with multiple vaccination, and it's minimize the vaccination expenses for the farmers. So, and for the duration of immunity, it's long lasting, at least it's 1 year. I hope that I'm at time, and thank you, asante sana. Thank you.
Thank you, Dr. Taha, for that interesting presentation. It's been a very, I think, informative session, being able to share with you some of the recent innovative solutions, in addition to what KVA is doing, that we are hoping that would be able to end up in the basket of our farmers and improve protection and take care of our herds. So in the interest of time, we know it is 1 and the glucose levels must have dropped significantly. We are going to have a quick interaction session, so a Q&A. We're not going to request the presenters to come to the front. Instead, where you are, we are going to share a mic. And then we are going to take just 3 questions, 3 burning questions that our presenters can respond to. And then we should be able to break for lunch. You forgot to play the video. I'm told there is 1 more short presentation before we break for lunch. Okay. If you have any question, as you lift your hand and you're getting the mic. Any other person with a question?
Of goats,
Yes.
sheep, or cattle for food and income. Now, imagine your animals get sick. Imagine you are a farmer whose family relies on a small herd of goats, sheep, or cattle for food and income. Now,
All right.
Yes, again, my name is Maritim. Just an observation in the presentations, they are very nice. My colleague in Kevevapi, I think from morning to now, we've seen that there is a role the university play in this vaccine production and research. But I've realized Kevevapi doesn't have a link with the university. Is there a reason for that? Can I repeat? Yeah, I'm just asking for the sake of clarity. Why is Kevevapi not involving the university in the research of vaccines? When I see the others, it looks like it is a direct link between the university and vaccine production in other countries. Thank you.
Good afternoon. Mine goes to our presenters, MSc, MCI, and Esther. Here in Kenya, we have a cadre of professionals, veterinary technicians, veterinary technologists. In Kenya, these are the people who are close to the farmer. Now, outside there, how do you do? Because I would like to understand how we will adopt here in Kenya to include the veterinary technicians and veterinary technologists.
Thank you. Dr. Sokas, veteran veterinarian. Hester, Africa. Your plant is in Dar es Salaam. Any reason it's not in Kwale, Kenya? Thank you.
Dr. Kibego, I'm asking a question. My name is Dr. Mutinda, not a veteran yet. My question is the presentation that was made on combined vaccine for PPR and sheep and goat pox. From my own understanding is that PPR is a lifetime vaccine, and sheep and goat pox we are vaccinating every year. So if we combine these two and we are vaccinating these sheep and goats every year, are we not adding an extra expense to the farmer who was supposed to just vaccinate PPR once in a lifetime, and now we are being forced to do the same over and over every year? So how best are we going to avoid this repetition of unnecessary PPR vaccine for the same herd every year? Thank you.
I think we'll take that. We'll take the 4 questions and then move into the next presentation. I think the first question was for you, Alex.
Thank you. Thank you. My question was from Dr. Maritim about collaboration. I want to confirm, even though we have not been moving a little bit faster, but as KVA, we are in the process of finalizing our R&D policy document that will define how we commercialize research from our facilities. So this discussion has been ongoing. We have engaged on a number of diseases. We are working with the Kenya Agriculture and Livestock Research Organization on PPR and other vaccines. So this collaboration is ongoing. Thank you.
The next question was?
I think it was a mutual question. So thank you, Doctor, for your... Okay, yes, for sure. Thank you, Doctor, for your question, and we appreciate. What I can say that even we produce in Morocco, we work closely with local partners and Kenyan vets. As you can see, the challenge, it was conducted in Calero. This is for development parts. And also bringing the solution to markets. We have several partners that we are working with, and we're still open to all your suggestions and all your inputs. Thank you.
Hello. So thank you for your queries. First, I mentioned why the plant in Tanzania, not in others part of Africa. And the reason is that from the operation and these geographical locations we have selected for that, we can, from the headquarter is in our India. So from here any plant, when we make this depends upon your number of risk-benefit analysis, risk factor for any vaccine and biologicals. For resources to run these organizations and political stability. It is altogether is a plan for that, but still it planned for the Africa. So from here we can enter Africa, enter Africa specific diseases. It is not at the Tanzania, Kenya like that. So it is your continent. Thank you. And the last question is that yes, this why the PPR combination of vaccines? Yes, for PPR, if we take this, I'm virologist, so I do not go deep into the subject of virology in the state. But yes, for the application part and all these things, why PPR vaccines? Yes, I know that it is the vaccines. It goes for the Nigerian strains. It is mentioned where that if you go for one vaccination, it goes minimum of 3 years, and sometimes it is if you keep there. But if you go to the field, there is a lot of trace into the animals. So one thing is that in the lab, another thing is that vaccines should perform into the field. So field, there is a lot of trace for these productions to remain healthy with these conditions. So it is not like that biologicals, what if you get into the conditions, it not every time follow your field conditions. So what is our observation is that I mean to say that the epidemiology of the diseases, I mean to say that it is the endemic, it is some area that may be the outbreak. So it is not that the vaccines will fail, not. The vaccine performance, it depends upon how it give the population protective, at least 70 to 80% of the populations. So yes, if you go for the PPR vaccinations, it depends upon minimum 3 years it gives the entire goat pox. Yes, it is a pox virus. So pox virus generally give protection. So any pox virus, you go for the Capri pox and your goat pox, sheep pox, any pox virus, as long as it gives immunity for 1 year. So immunity for 1 year, it's not that after 1 year it is directly go to the zero. So our vaccination schedule, it depends upon your epidemiology and endemic area of your particular regions. If you go that vaccines is good, not giving any adverse reactions, or so you can shift your vaccines, PPR combination vaccines after 3 years also. Not it is thumb rule. After 1 year you take the flock and give the vaccine. After 1 year give the vaccine. So any vaccinations, so that's why any vaccinations you mention in the label, please consult your veterinarian for this vaccination schedule. So this is always, it is not by the thumb rule. We should give some vigilance before going for the combination vaccine. Thank you all.
So we thank those presenters who are involved in that symposium, GalMed symposium, and for the great knowledge that they've been able to share with us. So we have one short presentation before we go for lunch. And this is not on ruminant matters, it is more of donkey and equine. So this will be by way of a video by Dr. Joe Collins. He is a chief veterinary advisor for the Donkey Sanctuary. He's a president of the Federation of European Equine Veterinary Association. So he's going to be speaking to us on a topic which he has entitled, Can Donkey Farming Provide a Sustainable Supply Chain? So I asked the IT team to now play the video, and Dr. Obadiah Singoe is here in case we will have any questions regarding the presentation. So as the video is being uploaded, then we can take a couple of announcements. One being about lunch. So lunch will be served at the buffet restaurant, which is where we were yesterday. The meal cards will be at the entrance of the restaurant. So if you have a yellow or a blue name tag like this, you will proceed to the restaurant, and that is where you will receive your meal card. So don't forget to carry your name tag. For those who have green name tags, you will see Dr. Joel Ruto, who is outside. And he will give you your meal card for that. Okay, lunch is going to be 1 hour, and we request you take as little time as possible during lunch. After lunch, then we'll proceed to the breakout sessions, these being Hall B, Hall C, and A as they were yesterday. So after lunch, after the 1 hour, then we'll proceed for the breakout sessions.
Hello, my name is Joe. Hello, my name is Joe Collins and I'm the Chief Veterinary Advisor at the Donkey Sanctuary, and I'm really grateful to the organisers of the Kenya Veterinary Association for allowing me to speak with you today about a really important subject, and that subject is donkeys, the global trade in donkey skins and donkey farming. I had the pleasure once of attending the KVA conference in Nairobi, and I look forward to an opportunity when I'm able to visit again in the future.
Colleagues, there's a bit of a technical hitch, so as it's being sorted out, I think it would be wise to just proceed for lunch. As I had announced, the lunch is at Buffet Restaurant, which is where we were yesterday. Meal cards will be given there. So it is now 1:28. 1 hour from now is about 2:30. So let's resume in the breakout rooms at 2:30. Enjoy your lunch.
whose family relies on a small herd of goats, sheep, or cattle for food and income. Now, imagine your animals get sick. They might have a runny nose or seem really tired. Because many different livestock diseases share these exact same clinical signs, it can be really hard to know which illness is making your herd sick. Your livelihood, which depends on the health of your animals, is at risk. This is the reality faced by millions of people around the world. To make things harder, small-scale livestock producers often live in remote areas, far from veterinarians, and buying vaccines and medicines can be very expensive for them. Many disease control programs usually focus on treating just one disease at a time. In reality, they need to handle a whole range of dangerous diseases all at once. So, what is the best solution? The answer is combination or multivalent vaccines, which protect animals from several diseases in one injection. Instead of giving many different vaccines, farmers can protect their livestock with fewer injections. What are the benefits of using combination vaccines? With one vaccine, animals are protected against several diseases at the same time. This means farmers do not have to buy many different vaccines. It also means fewer injections for the animals. Farmers spend less time vaccinating their livestock and less money on labor. Fewer vaccinations also mean less stress for animals, helping them stay healthy and productive. Because several diseases are covered in one vaccination, veterinarians may only need to visit once instead of many times. Combination vaccines keep livestock protected while saving time, effort, and money. The Global Alliance for Livestock Veterinary Medicines, GALVMED, has worked with various partners to develop several combination vaccines to fight major livestock diseases across Africa, such as contagious caprine pleuropneumonia, sheep and goat pox, peste des petits ruminants, Newcastle disease, infectious bursal disease, contagious bovine pleuropneumonia, lumpy skin disease, and a concurrent vaccine for Rift Valley fever. By offering a simple all-in-one shield, combination vaccines provide the best possible value for farmers. They ensure that even the most remote communities can keep their animals healthy, improve their income, and protect their livelihoods. Let's protect our livestock. Let's vaccinate.
Did you know that cattle, sheep, and goats, also known as ruminants, are incredibly important to our world? For many families, especially across Africa, these animals are their main source of food and income. But there is a hidden danger. These animals are vulnerable to highly contagious and deadly diseases. You may have heard of foot and mouth disease, lumpy skin disease, or sheep and goat pox. When an outbreak hits, the results can be devastating. Sick animals grow slower, produce less milk, and have fewer healthy babies. In the worst cases, outbreaks cause high numbers of deaths and cost farmers enormous amounts of money. Entire communities can face strict restrictions on trading their animals. But there is a simple, powerful solution: vaccination. Vaccinating animals is like giving them an invisible shield. And here is the thing: it is far cheaper to vaccinate an animal than to manage a massive disease outbreak. Vaccinated animals stay healthy. They gain weight faster, produce more milk, and have much better fertility. Healthy livestock means reliable income for small-scale producers and a stable supply of meat and milk for everyone. Vaccines can even eliminate diseases entirely. We have already wiped out a terrible disease called rinderpest. And right now, global efforts are working hard to eradicate another disease called peste des petites ruminants, known simply as PPR. Organizations like GalVmed are working alongside key stakeholders in animal health in Kenya, Tanzania, and Nigeria to get more animals vaccinated. Together, we can save animal lives, increase incomes, and build stronger, more resilient communities. Let's protect our livestock. Let's vaccinate.
Every big impact begins with a single drop of science. A ripple that travels far, safeguarding animals, empowering farmers, protecting lives. At Hester Biosciences, this is our purpose: to build a safer, healthier world, one dose at a time. For 38 years, we've stood at the intersection of science, innovation, and trust. Our journey is measured in impact. Over 4 billion vaccine doses manufactured annually, 260 million animals protected each year, and a presence in more than 35 countries. At the heart of our innovation is our flagship R&D center in India, driving breakthroughs, backed by diagnostic labs that enable early detection and fast response. Our challenge unit tests every breakthrough rigorously, so farmers and governments can place their trust in every vial. In a world where human health begins with animal health, we lead with the One Health vision. Through our partnership with GalVmed and with the backing of global voices like the Gates Foundation, we delivered one of the world's largest backyard poultry immunization drives, protecting the most underserved, where help was needed most. From our advanced facility in Ahmedabad to Nepal's first private animal vaccine plant to our world-class site in Tanzania, our reach expands every year.
It's not just about manufacturing vaccines and achieving profitability in the company. It is about being a contributor to the growth of nations that would lead to giving a lot of employment to people all across the world, not only in Africa, also in India.
Today, our global capacity stands at 8.99 billion doses annually. Each one a promise of precision, protection, and purpose. And as new challenges emerge, we stand ready, firm against threats like antimicrobial resistance, led by science, grounded in responsibility, built for tomorrow.
We are currently giving a lot of importance to our R&D activities. We are working on some next generation technologies, as well as trying to strengthen our current product portfolio.
Our commitment is future ready. Our solutions are sustainably focused. And since launching Pet Care in 2022, our dedication has extended into every home, because every pet deserves the promise of science-led wellness. At Hester Biosciences, every drop of science creates infinite ripples of health, trust, and hope. Science-backed, purpose-driven, future-ready. Food does more than fill a plate. It builds strength, fuels the hustle, and shapes the future of our families. But as our needs grow, so must how we produce and what we eat, because one of the most promising proteins remains underutilized. Pork.
We want farmers who are passionate and understand what they're getting into and what it requires from a farmer's choice perspective to produce a quality pig. So the farmer has to be meeting all the standards and ready to walk the entire journey with us, because our team will constantly visit your farm, request for data that will allow us to do the traceability process and then guide you in any areas that we think you need support in.
Across Kenya, farmers are discovering new opportunity through a value chain that is growing and evolving.
When it goes into production, of course, we just ensure that all the food safety management systems that are required to assure a safe product are complied with.
From responsible farming to traceable sourcing, quality begins long before the plate. In supermarkets, butcheries and markets, standards, consistency and trust drive demand and build confidence.
Best meal we've had here. Let's get to it.
From kitchens to restaurants, pork is being reimagined as a modern, everyday protein, a powerful source of nutrients supporting energy, focus, and overall health. With the right collaborations and coordinated action, the pig value chain can unlock opportunity at scale.
One of the areas we've been big on is making sure that the consumer can enjoy a value-added product. And we did a lot of trainings with the chefs to educate the consumer. And this consistency and the quality is what still makes a Kenyan or an international guest who's visited us over 30 years ago will still enjoy that signature taste.
From farm to table, every step matters. Every product is crafted with precision, ensuring that what reaches your table from our farms is nutritious, high quality, safe, and fully traceable, so our consumers can enjoy timeless, joyful moments with products they trust. And at the heart of it all is the Kenyan family, choosing meals that nourish, support, and sustain. Today, pork remains underutilized, but its potential is clear to strengthen food security, empower farmers, and contribute to a healthier nation. Pork power, pork safi, life safi.
Since 1984, Kenchik has been a major supplier of poultry to families throughout Kenya. Our standards in quality, hygiene, traceability, and sustainable farming are second to none. Our business is about far more than putting food on the table. By providing a livelihood to poultry farmers, we support communities throughout the region. Each passing year sees more and more Kenyans switching to chicken as a major source of protein. It's a trend that will cement Kenchik's brand as a major contributor to the economy.
Today, we've seen beef prices rising, and we've seen chicken now becoming more and more affordable as the primary source of protein.
We can see the growth in the fast food sector, in the restaurants, in the QSRs. It's growing in popularity.
People understand how to cook it better and more experimental, and of course it's convenient.
Kenchik's success can be put down to several key factors. Each of them is built on a philosophy that makes us unique.
As a company, we've always sought to seek out the highest quality standards possible.
For 40 years now, we always lean on the side of quality. We refuse to cut corners in our processes just to make a quick buck.
We have our genetics companies and consultant veterinarians which routinely audit us for our best practice in our farming and agricultural operations. From there, really, we have taken what we consider to be the right things to do, which we know delivers a great product. Traceability in any food production system means that you have well-documented, well-listed procedures at every single stage of production.
Every audit that we go through is a process for improvement, and that we are adhering to all the standards that our customers have always expected us to, and exceed them.
When you look at the Transform Antimicrobial Stewardship Program, well, that's the use of antibiotic stewardship scheme with USAID, linked with Cargill. They very kindly came to talk to us and whether we will be a party on antimicrobial resistance and how we could overcome it. And that's been a great accolade for us. And it's also taught us a lot in our business.
We can sleep at night knowing that our certifications are not just hangings on the wall. We know that we put in the work and we exceed local and regulatory requirements in every way.
We as Kenchik look at sustainability. It's the ability to produce food or a product without negatively impacting the environment and our communities around us. We, for instance, do not use charcoal in our business. We have physically covered our processing plant and our hatchery in just over $1 million worth of investment into solar panels which power during the day. We're seeing that that's probably going to have a massive, massive lowering of our need for grid electricity and how that grid electricity could be produced.
The communities that surround our businesses are so important to us, and we're so passionate about how we coexist with these communities, and we go the extra mile to ensure that we are not just conscious of the hardships they go through, but also what part we can play in helping to ease that burden. For example, we've got farms in Kajiado, and the communities around those farms where there is persistent water issues, we deliver water to homesteads that have got big tanks, and communities are able to come to these centers and draw water with smaller jerry cans, significantly reducing the distance that these communities have to walk to access water. We're also very passionate about protein consumption in general, and we provide on a regular basis eggs to these communities around us, keen that they consume the level of protein that is required for healthy living. We're a very passionate team. It's diverse, cross-generational, highly trained, who are passionate about the product and are willing to give their best to ensure that the product that goes in the market exceeds customer expectation.
We train the staff in very many ways. When you bring you on board, we give you a maximum of 3 months on a probation. During this period, we have to take you through a training program that is all round. We call it a 360 training. But it starts right from the farms to where we interact with the consumers. So it builds their confidence in terms of how they interact with the consumers.
Kenchik also maintains a close relationship with its outgrower farmers, reaching more than 22,000 week in, week out.
Our main aim with farmers is to ensure that they can grow their chicken most profitably at the end of the day. We understand that that profit story comes from doing the right job, managing your birds correctly.
Kenchik is very supportive, and I'm very proud of Kenchik. I'm very proud of the management of Kenchik, what they are doing to us. Are we going to win? Yes. Are we going to take the points? Yes. This is our day. Let's go and do it. Sawa Jama? Well done, boys. Our objective is to go to the top tier league, of which we are going to achieve. I believe in my boys, I believe in the team, I believe in the entire management.
Whether it's caring for staff, working with farmers, or identifying new markets, Kenchik revolves around the needs of its customers. After 40 years of success, the company is still looking forward to further possibilities.
I'm completely optimistic. I really am. I mean, you can look around the world and follow trends. It is without doubt going to be the protein of the future.
We are known to be the people who are cuckoo about chicken. Now our vision is to be the food partner of choice. We're absolutely looking to diversify into other protein areas and other food sectors. And in saying food, it's opened up a wide vista of opportunities and areas where we can explore as a business. So watch this space. We are coming in there and we're innovating hard.
Did you know that Alta Concepts Plus is twice as accurate as sire conception rate at predicting the next pregnancy in your herd? That's because SCR only measures the fertility of conventional semen used on cows, which is less than a third of all breedings in North America. What about sexed semen fertility? What about sire fertility in heifer breeding programs? Alta Concepts Plus has you covered. Concept Plus is complete with 5 separate sire fertility ratings that account for semen type and where the semen is used. Concept Plus is always current. It includes the most recent 2 years of data, and new evaluations are released 6 times per year. Concept Plus is consistent, since it only includes pregnancy check results directly from herd management software in large progressive dairies. That makes Concept Plus twice as accurate as SCR at predicting the next pregnancy in your herd. Early and accurate pregnancy detection is crucial in dairy farming. Traditional methods like rectal palpation and ultrasound often require specialized skills, can be stressful for the animals, and usually can't confirm pregnancy until 60 to 90 days after insemination. In dairy farming, timely and accurate pregnancy detection is crucial for effective herd management. Introducing Prompt Bovacy, the innovative early pregnancy detection kit, designed to provide quick, accurate, and stress-free results in just 28 days after artificial insemination. Let's see how it works. Step 1. Sample collection. Collect 2 to 3 milliliters of blood from the animal's tail, jugular, or ear vein after 28 days of artificial insemination. Step 2. Sample preparation. Add 3 drops of blood to the test strip's sample well. Step 3. Add diluent. Add 2 drops of diluent to the sample well. Get results in just 20 minutes. For accurate interpretation, read the results within 10 minutes. If the T line is darker than B line, then the animal is pregnant. If the T line is lighter and visible compared to the B line, then the animal is not pregnant. If the T line looks similar to the B line, then recheck the animal's pregnancy after 10 days. If the C line is not visible, then the result is invalid. Prompt BOF Easy offers numerous benefits, making it a game changer for modern dairy farming. Safe for embryos and imported semen, reducing the risk of embryo mortality from handling during rectal exams. Non-invasive tests reduce animal stress compared to rectal exams. It detects pregnancy-associated glycoprotein with 98% accuracy, which is higher than that of hormone-detecting kits. Prompt Bovacy Pregnancy Detection Kit, early, accurate, and stress-free detection.
Protect your livestock in this rainy season with Wormicide Plus O. Here's why your animals need extra protection. Dangerous worms thrive during the rains. These include worms such as roundworms, liver flukes, and lungworms. Even before symptoms show, your animals are losing. This comes with reduced weight gain, low energy, and poor feed conversion. When it gets worse, production drops dramatically. One treatment that targets the season's most dangerous worms is Wormicide Plus O. Why it stands out? Broad-spectrum deworming against liver flukes, roundworms, and lungworms. Easy application using a drench gun or a syringe. It boosts livestock growth and productivity. After treatment, you will begin to see increased milk, better weight, improved fertility, and strong immunity. Keep your livestock healthy and productive. Get Wormicide Plus O today from your nearest agrovet or contact us on 0722 333 834. For more information, visit cosmos.fulolizol.com or dial *483 *585 *6# to access offline. Cosmos, your partner in livestock wellness.
Imagine you are a farmer whose family relies on a small herd of goats, sheep, or cattle for food and income. Now, imagine your animals get sick. They might have a runny nose or seem really tired. Because many different livestock diseases share these exact same clinical signs, it can be really hard to know which illness is making your herd sick. Your livelihood, which depends on the health of your animals, is at risk. This is the reality faced by millions of people around the world. To make things harder, small-scale livestock producers often live in remote areas, far from veterinarians, and buying vaccines and medicines can be very expensive for them. Many disease control programs usually focus on treating just one disease at a time. In reality, they need to handle a whole range of dangerous diseases all at once. So, what is the best solution? The answer is combination or multivalent vaccines, which protect animals from several diseases in one injection. Instead of giving many different vaccines, farmers can protect their livestock with fewer injections. What are the benefits of using combination vaccines? With one vaccine, animals are protected against several diseases at the same time. This means farmers do not have to buy many different vaccines. It also means fewer injections for the animals. Farmers spend less time vaccinating their livestock and less money on labor. Fewer vaccinations also mean less stress for animals, helping them stay healthy and productive. Because several diseases are covered in one vaccination, veterinarians may only need to visit once instead of many times. combination vaccines keep livestock protected while saving time, effort, and money. The Global Alliance for Livestock Veterinary Medicines, GalvMed, has worked with various partners to develop several combination vaccines to fight major livestock diseases across Africa, such as contagious caprine pleuropneumonia, sheep and goat pox, peste des petits ruminants, Newcastle disease, infectious bursal disease, contagious bovine pleuropneumonia, lumpy skin disease, and a concurrent vaccine for Rift Valley fever. By offering a simple all-in-one shield, combination vaccines provide the best possible value for farmers. They ensure that even the most remote communities can keep their animals healthy, improve their income, and protect their livelihoods. Let's protect our livestock. Let's vaccinate.
Did you know that cattle, sheep, and goats, also known as ruminants, are incredibly important to our world? For many families, especially across Africa, these animals are their main source of food and income. But there is a hidden danger. These animals are vulnerable to highly contagious and deadly diseases. You may have heard of foot and mouth disease, lumpy skin disease, or sheep and goat pox. When an outbreak hits, the results can be devastating. Sick animals grow slower, produce less milk, and have fewer healthy babies. In the worst cases, outbreaks cause high numbers of deaths and cost farmers enormous amounts of money. Entire communities can face strict restrictions on trading their animals. But there is a simple, powerful solution: vaccination. Vaccinating animals is like giving them an invisible shield. And here is the thing: it is far cheaper to vaccinate an animal than to manage a massive disease outbreak. Vaccinated animals stay healthy. They gain weight faster, produce more milk, and have much better fertility. Healthy livestock means reliable income for small-scale producers and a stable supply of meat and milk for everyone. Vaccines can even eliminate diseases entirely. We have already wiped out a terrible disease called rinderpest. And right now, global efforts are working hard to eradicate another disease called peste des petits ruminants, known simply as PPR. Organizations like GalvMed are working alongside key stakeholders in animal health in Kenya, Tanzania, and Nigeria to get more animals vaccinated. Together, we can save animal lives, increase incomes, and build stronger, more resilient communities. Let's protect our livestock. Let's vaccinate.
Every big impact begins with a single drop of science. A ripple that travels far, safeguarding animals, empowering farmers, protecting lives. At Hester Biosciences, this is our purpose: to build a safer, healthier world, one dose at a time. For 38 years, we've stood at the intersection of science, innovation, and trust. Our journey is measured in impact. Over 4 billion vaccine doses manufactured annually, 260 million animals protected each year, and a presence in more than 35 countries. At the heart of our innovation is our flagship R&D center in India, driving breakthroughs, backed by diagnostic labs that enable early detection and fast response. Our challenge unit tests every breakthrough rigorously, so farmers and governments can place their trust in every vial. In a world where human health begins with animal health, we lead with the One Health vision. Through our partnership with GalvMed and with the backing of global voices like the Gates Foundation, we delivered one of the world's largest backyard poultry immunization drives, protecting the most underserved, where help was needed most. From our advanced facility in Ahmedabad to Nepal's first private animal vaccine plant to our world-class site in Tanzania, our reach expands every year.
It's not just about manufacturing vaccines and achieving profitability in the company. It is about being a contributor to the growth of nations that would lead to giving a lot of employment to people all across the world, not only in Africa, also in India.
Today, our global capacity stands at 8.99 billion doses annually. Each one a promise of precision, protection, and purpose. And as new challenges emerge, we stand ready. Firm against threats like antimicrobial resistance, led by science, grounded in responsibility, built for tomorrow.
We are currently giving a lot of importance to our R&D activities. We are working on some next generation technologies as well as trying to strengthen our current product portfolio.
Our commitment is future ready. Our solutions are sustainably focused. And since launching Pet Care in 2022, our dedication has extended into every home, because every pet deserves the promise of science-led wellness. At Hester Biosciences, every drop of science creates infinite ripples of health, trust, and hope. Science-backed, purpose-driven, future-ready.
Pork power.
Every day in Kenya, food does more than fill a plate. It builds strength, fuels the hustle, and shapes the future of our families. But as our needs grow, so must how we produce and what we eat, because one of the most promising proteins remains underutilized: pork.
We want farmers who are passionate and understand what they are getting into and what it requires from a farmer's choice perspective to produce a quality pig. So the farmer has to be meeting all the standards and ready to walk the entire journey with us, because our team will constantly visit your farm, request for data that will allow us to do the traceability process and then guide you in any areas that we think you need support in.
Across Kenya, farmers are discovering new opportunity through a value chain that is growing and evolving.
When it goes into production, of course, we just ensure that all the food safety management systems that are required to assure a safe product are complied with.
From responsible farming to traceable sourcing, quality begins long before the plate. In supermarkets, butcheries and markets, standards, consistency and trust drive demand and build confidence.
This meal we've had here, let's get to it.
From kitchens to restaurants, pork is being reimagined as a modern, everyday protein, a powerful source of nutrients supporting energy, focus and overall health. With the right collaborations and coordinated action, the pig value chain can unlock opportunity at scale.
One of the areas we've been big on is making sure that the consumer can enjoy a value-added product. And we did a lot of trainings with the chefs to educate the consumer. And this consistency and the quality is what still makes a Kenyan or an international guest who's visited us over 30 years ago will still enjoy that signature taste.
From farm to table, every step matters. Every product is crafted with precision, ensuring that what reaches your table from our farms is nutritious, high quality, safe and fully traceable, so our consumers can enjoy timeless, joyful moments with products they trust. And at the heart of it all is the Kenyan family, choosing meals that nourish, support and sustain. Today, pork remains underutilized, but its potential is clear to strengthen food security, empower farmers, and contribute to a healthier nation. Pork power, pork safi, life safi.
Since 1984, Kenchik has been a major supplier of poultry to families throughout Kenya. Our standards in quality, hygiene, traceability and sustainable farming are second to none. Our business is about far more than putting food on the table. By providing a livelihood to poultry farmers, we support communities throughout the region. Each passing year sees more and more Kenyans switching to chicken as a major source of protein. It's a trend that will cement Kenchik's brand as a major contributor to the economy.
Today, we've seen beef prices rising and we've seen chicken now becoming more and more affordable as the primary source of protein.
We can see the growth in the fast food sector, in the restaurants, in the QSRs. It's growing in popularity.
People understand how to cook it better and more experimental, and of course it's convenient.
Kenchik's success can be put down to several key factors. Each of them is built on a philosophy that makes us unique.
As a company, we've always sought to seek out the highest quality standards possible.
For 40 years now, we always lean on the side of quality. We refuse to cut corners in our processes just to make a quick buck.
We have our genetics companies and consultant veterinarians which routinely audit us for our best practice in our farming and agricultural operations. From there, really, we have taken what we consider to be the right things to do, which we know delivers a great product. Traceability in any food production system means that you have well-documented, well-listed procedures at every single stage of production.
Every audit that we go through is a process for improvement, and that we are adhering to all the standards that our customers have always expected us to, and exceed them.
When you look at the Transform Antimicrobial Stewardship Program, that's the use of antibiotic stewardship scheme with USAID, linked with Cargill. They very kindly came to talk to us and whether we will be a party on antimicrobial resistance and how we can overcome it. And that's been a great accolade for us. And it's also taught us a lot in our business.
We can sleep at night knowing that our certifications are not just hangings on the wall. We know that we put in the work and we exceed local and regulatory requirements in every way.
We as Kenchik look at sustainability. It's the ability to produce food or a product without negatively impacting the environment and our communities around us. We, for instance, do not use charcoal in our business. We have physically covered our processing plant and our hatchery in just over $1 million worth of investment into solar panels which power during the day. We're seeing that that's probably going to have a massive lowering of our need for grid electricity and how that grid electricity could be produced.
The communities that surround our businesses are so important to us, and we're so passionate about how we coexist with these communities, and we go the extra mile to ensure that we are not just conscious of the hardships they go through, but also what part we can play in helping to ease that burden. For example, we've got farms in Kajiado, and the communities around those farms where there is persistent water issues, we deliver water to homesteads that have got big tanks, and communities are able to come to these centers and draw water with smaller jerry cans, significantly reducing the distance that these communities have to walk to access water. We're also very passionate about protein consumption in general, and we provide on a regular basis eggs to these communities around us, keen that they consume the level of protein that is required for healthy living. We're a very passionate team. It's diverse, cross-generational, highly trained, who are passionate about the product and are willing to give their best to ensure that the product that goes in the market exceeds customer expectation.
We train the staff in very many ways. When you bring you on board, we give you a maximum of 3 months on a probation. During this period, we have to take you through a training program that is all round. We call it a 360 training, because it starts right from the farms to where we interact with the consumers. So it builds their confidence in terms of how they interact with the consumers.
Kenchik also maintains a close relationship with its outgrower farmers, reaching more than 22,000 week in, week out.
Our main aim with farmers is to ensure that they could grow their chicken most profitably at the end of the day. We understand that that profit story comes from doing the right job, managing your birds correctly.
Kenchik is very supportive, and I'm very proud of Kenchik. I'm very proud of the management of Kenchik, what they are doing to us. Are we going to win? Yes. Are we going to take the points? Yes. This is our day. Let's go and do it. Sawa Jama? Yes. Well done, boys. Our objective is go to the top tier league, of which we are going to achieve. I believe in my boys, I believe in the team, I believe in the entire management.
Whether it's caring for staff, working with farmers, or identifying new markets, Kenchik revolves around the needs of its customers. After 40 years of success, the company is still looking forward to further possibilities.
I'm completely optimistic. I really am. I mean, you can look around the world and follow trends. It is without doubt going to be the protein of the future.
We are known to be the people who are cuckoo about chicken. Now our vision is to be the food partner of choice. We're absolutely looking to diversify into other protein areas and other food sectors. And in saying food, it's opened up a wide vista of opportunities and areas where we can explore as a business. So watch this space. We are coming in there and we're innovating hard.
Did you know that Alta Concepts Plus is twice as accurate as sire conception rate at predicting the next pregnancy in your herd? That's because SCR only measures the fertility of conventional semen used on cows, which is less than a third of all breedings in North America. What about sexed semen fertility? What about sire fertility in heifer breeding programs? Alta Concept Plus has you covered. Concept Plus is complete with 5 separate sire fertility ratings that account for semen type and where the semen is used. Concept Plus is always current. It includes the most recent 2 years of data, and new evaluations are released 6 times per year. Concept Plus is consistent, since it only includes pregnancy check results directly from herd management software in large, progressive dairies. That makes Concept Plus twice as accurate as SCR at predicting the next pregnancy in your herd.
Early and accurate pregnancy detection is crucial in dairy farming. Traditional methods like rectal palpation and ultrasound often require specialized skills, can be stressful for the animals, and usually can't confirm pregnancy until 60 to 90 days after insemination. In dairy farming, timely and accurate pregnancy detection is crucial for effective herd management. Introducing Prompt Bovacy, the innovative early pregnancy detection kit, designed to provide quick, accurate, and stress-free results in just 28 days after artificial insemination. Let's see how it works. Step 1. Sample collection. Collect 2 to 3 milliliters of blood from the animal's tail, jugular, or ear vein after 28 days of artificial insemination. Step 2. Sample preparation. Add 3 drops of blood to the test strips sample well. Step 3. Add diluent. Add 2 drops of diluent to the sample well. Get results in just 20 minutes. For accurate interpretation, read the results within 10 minutes. If the T line is darker than B line, then the animal is pregnant. If the T line is lighter and visible compared to the B line, then the animal is not pregnant. If the T line looks similar to the B line, then recheck the animal's pregnancy after 10 days. If the C line is not visible, then the result is invalid. Prompt BOF Easy offers numerous benefits, making it a game changer for modern dairy farming. Safe for embryos and imported semen, reducing the risk of embryo mortality from handling during rectal exams. Non-invasive tests reduce animal stress compared to rectal exams. It detects pregnancy-associated glycoprotein with 98% accuracy, which is higher than that of hormone-detecting kits. Prompt Bovacy Pregnancy Detection Kit, early, accurate, and stress-free detection.
Protect your livestock in this rainy season with Wormside Plus O. Here's why your animals need extra protection. Dangerous worms thrive during the rains. These include worms such as roundworms, liver flukes, and lungworms. Even before symptoms show, your animals are losing. This comes with reduced weight gain, low energy, and poor feed conversion. When it gets worse, production drops dramatically. One treatment that targets the season's most dangerous worms is Wormside Plus O. Why it stands out? Broad spectrum deworming against liver flukes, roundworms, and lungworms. Easy application using a dredge gun or a syringe. It boosts livestock growth and productivity. After treatment, you will begin to see increased milk, better weight, improved fertility, and strong immunity. Keep your livestock healthy and productive. Get Wormicide Plus O today from your nearest agrovet or contact us on 0722 333 834. For more information, visit cosmos.fulolizol.com or dial *483 585 *6# to access offline. Cosmos, your partner in livestock wellness.
Imagine you are a farmer whose family relies on a small herd of goats, sheep, or cattle for food and income. Now, imagine your animals get sick. They might have a runny nose or seem really tired. Because many different livestock diseases share these exact same clinical signs, it can be really hard to know which illness is making your herd sick. Your livelihood, which depends on the health of your animals, is at risk. This is the reality faced by millions of people around the world. To make things harder, small-scale livestock producers often live in remote areas, far from veterinarians, and buying vaccines and medicines can be very expensive for them. Many disease control programs usually focus on treating just one disease at a time. In reality, they need to handle a whole range of dangerous diseases all at once. So, what is the best solution? The answer is combination or multivalent vaccines, which protect animals from several diseases in one injection. Instead of giving many different vaccines, farmers can protect their livestock with fewer injections. What are the benefits of using combination vaccines? With one vaccine, animals are protected against several diseases at the same time. This means farmers do not have to buy many different vaccines. It also means fewer injections for the animals. Farmers spend less time vaccinating their livestock and less money on labor. Fewer vaccinations also mean less stress for animals, helping them stay healthy and productive. Because several diseases are covered in one vaccination, veterinarians may only need to visit once instead of many times. Combination vaccines keep livestock protected while saving time, effort, and money. The Global Alliance for Livestock Veterinary Medicines, GALVMed, has worked with various partners to develop several combination vaccines to fight major livestock diseases across Africa, such as contagious caprine pleuropneumonia, sheep and goat pox, peste des petits ruminants, Newcastle disease, infectious bursal disease, contagious bovine pleuropneumonia, lumpy skin disease, and a concurrent vaccine for Rift Valley fever. By offering a simple all-in-one shield, combination vaccines provide the best possible value for farmers. They ensure that even the most remote communities can keep their animals healthy, improve their income, and protect their livelihoods. Let's protect our livestock. Let's vaccinate.
Did you know that cattle, sheep, and goats, also known as ruminants, are incredibly important to our world? For many families, especially across Africa, these animals are their main source of food and income. But there is a hidden danger. These animals are vulnerable to highly contagious and deadly diseases. You may have heard of foot and mouth disease, lumpy skin disease, or sheep and goat pox. When an outbreak hits, the results can be devastating. Sick animals grow slower, produce less milk, and have fewer healthy babies. In the worst cases, outbreaks cause high numbers of deaths and cost farmers enormous amounts of money. Entire communities can face strict restrictions on trading their animals. But there is a simple, powerful solution: vaccination. Vaccinating animals is like giving them an invisible shield. And here is the thing, it is far cheaper to vaccinate an animal than to manage a massive disease outbreak. Vaccinated animals stay healthy. They gain weight faster, produce more milk, and have much better fertility. Healthy livestock means reliable income for small-scale producers and a stable supply of meat and milk for everyone. Vaccines can even eliminate diseases entirely. We have already wiped out a terrible disease called rinderpest. And right now, global efforts are working hard to eradicate another disease called peste des petites ruminants, known simply as PPR. Organizations like GalvMed are working alongside key stakeholders in animal health in Kenya, Tanzania, and Nigeria to get more animals vaccinated. Together, we can save animal lives, increase incomes, and build stronger, more resilient communities. Let's protect our livestock. Let's vaccinate.
Every big impact begins with a single drop of science. A ripple that travels far, safeguarding animals, empowering farmers, protecting lives. At Hester Biosciences, this is our purpose: to build a safer, healthier world, one dose at a time. For 38 years, we've stood at the intersection of science, innovation, and trust. Our journey is measured in impact. Over 4 billion vaccine doses manufactured annually, 260 million animals protected each year, and a presence in more than 35 countries. At the heart of our innovation is our flagship R&D center in India, driving breakthroughs, backed by diagnostic labs that enable early detection and fast response. Our challenge unit tests every breakthrough rigorously, so farmers and governments can place their